programming this year. Before we begin, I want to take a moment to thank the team of incredible women who are working with me this year behind the scenes and today introducing some of our panels for their courage, commitment, and vision, particularly during this most difficult time as we grieve and protest. I'm truly grateful for their collaboration in all of this work. I also want to thank all of the folks at Ostara Initiative, the Minnesota Prison Doula Project, the Alabama Birth Prison Project, and especially Colleen Bell for introducing us to this concern and extending the invitation to join together with this incredible group that inspires me daily with their vision and commitment. Today, we all come together in community to discuss reproductive injustice, birth behind bars. But we are reminded that our conversation today is in the context of police violence in our home community and our communities across the country. We cannot divorce police violence and larger prison industrial complex from our conversation today. Police violence and systemic racism are intertwined public health crises. As we approach this work today, I want to center truth. This nation was built on white supremacy and the murders of a seemingly unending list of Black and Indigenous people of color who are falsely arrested or attacked, brutalized, and killed with impunity is a symptom of this reality. Their deaths have occurred in a context in which Black people are also far likelier to die from COVID-19 than their white counterparts. The current recession has hit Black communities particularly hard, as they and their families are already navigating employment, discrimination, and wealth inequality, which are themselves just two products of racialized violence rooted in centuries-old legacies of slavery, discrimination, and exploitation. Our cities, Minneapolis and St. Paul, are hurting, grieving, and protesting. Many of you here today are from Minnesota, but many of you are not. Please note that the majority of our panelists are from Minnesota, and their experiences and expertise is absolutely and necessarily impacted by what is happening here. Today, we come together around reproductive injustice or reproductive justice, the human right to control our sexuality, our gender, our work, and our reproduction that can only be achieved when all people have the complete economic, social, and political power and resources to make healthy decisions about our bodies, our families, and our communities in all areas of our lives. It must be acknowledged that this framework evolved out of the transformational work of an incredible group, the Women of African Descent for Reproductive Justice, which gathered in 1994, and which is led by Sister Song today. And if you don't already, please follow their work. It's incredible. Birth in prison is absolutely a vital area of reproductive justice, and we are here today to engage you at this intersection. It gives me great pleasure to share this space with Erica Gerrity. And Erica, I'm going to let you introduce yourself.
My name is Erica Gerrity. I'm the co-founder of the Minnesota Prison Doula Project and the executive director of the Ostara Initiative, which is the mother organization of the prison birth work in the state of Minnesota and the state of Alabama. As an organization, we exist to collectively transform systems by reimagining justice, advancing health, and reclaiming dignity in our policies and practices for all pregnant and parenting people. Our goal is to end prison birth in America. So as you can imagine, we're quite excited for this conversation today. I want to thank Susi Keefe, all of her amazing students who you'll get a chance to meet today, and Rachel Freeman Cook on our team for their work in planning this event. For this, I want to thank the Center for Justice and the Law for sponsoring this event. I'm blessed to call many of the speakers you'll hear from today some of my closest colleagues. I feel that the conversation you're about to hear is the most substantively curated conversation on this topic that has ever been held in our country. 16 years ago, when women in Shakopee Women's Prison approached me to have a conversation about how to better support the women that were going through pregnancy and birth inside, very few people were talking about this issue in the world. I want to acknowledge this moment as a small step forward towards truth and a foundation for hopefully future justice. Thank you for joining us.
And I realized I didn't even say my name as I began. I was so eager to jump right in. I'm Susi Keefe. I am the director of the Center for Justice and Law at Hamline and professor of public health and sociology. Just as a in case you're wondering, who is that person speaking? We're just so excited to get right into it. So our format for today, we've shared our panelists' bios and photos with you ahead of time, but we'll drop that link in the chat again, and we will allow you to engage with their bios as you wish. But we've asked our speakers to introduce themselves more informally today as they speak, so that we can really center the discussions. We are live streaming today's event on Facebook. If you step away or wish to revisit any of what is shared today, it will be archived and available at our CJL Facebook site. We don't have any scheduled breaks today, but please feel free to grab your lunch and take breaks as needed. We recognize that it's 4.5 hours is not a short amount of time, and we understand if you need to step away. One last thing, Hamline professor Dr. Shelley Schaefer led the development of a think tank at Shakopee Women's Prison here in Minnesota in the fall of 2021, and that continues on this spring. Think tanks are an extension of the Inside Out Prison Exchange Program, focused on bringing a group of individuals to come together to focus on community building, social justice, education, and leadership development. And due to COVID restrictions, the 9 think tank members at Shakopee have had to work remotely, but they have successfully achieved approval to have this event recording be looped on the internal television channel inside Shakopee Prison, and it will be accessible by all incarcerated individuals in the facility at a later date. We'll be able to share a recording, but they have permission to share this event with all in the prison. In addition, the think tank members gathered questions to ask the panelists on behalf of those incarcerated at Shakopee, and for this we are grateful that our conversation today includes them. I'm now going to ask Rachel to introduce our first speaker today.
Hi, everyone. My name is Rachel Freeman Cook. I work with the Ostara Initiative. When I was a college student studying anthropology, gender studies, and public policy, I came across a book that changed my life. Jail Care raises essential questions about institutional inequality, the failings of the American social safety net, and the realities of mass incarceration, specifically for justice-involved women. After reading Jail Care, I became outrageously passionate about the intersection of reproductive healthcare access and criminal justice reform, so much so that I sent an email to Erica Gerrity, who you just heard from, essentially begging to do my thesis research with the Minnesota Prison Doula Project. 3 years later, I'm still working with the MNPDP, and I'm thrilled to introduce today's first speaker, medical anthropologist and OBGYN at Johns Hopkins University, and the author of Jail Care, Finding the Safety Net for Women Behind Bars, Dr. Carolyn Sufrin.
Wow, thank you so much, Rachel, for that really meaningful introduction. If you could allow me to share my screen, I don't have the ability to do that. As that's happening, I just want to acknowledge where I'm coming from. I'm a white cisgendered woman. As Rachel mentioned, I'm an OBGYN, so I'm a physician, and I'm also a researcher and a medical anthropologist. I have never been incarcerated myself, and so there are limits to what the perspectives I can offer. I have worked, however, as a physician in a jail. I worked for over 6 years in the San Francisco jail, providing healthcare, and that's also where I conducted the ethnographic fieldwork that is the subject of the book you heard about. And I do this work led by, I am led by and inspired by the work of directly impacted folks, many of whom we'll hear from today. And it's important to me, and the goal of the research that I do, that it's meaningful and applicable and can help contribute in some way to making change. I am speaking to you today from Washington, D.C. on the ancestral lands of the Anacostans, and I thank Susi for providing the context for all of us of the land that we are on. And I think now I should have the ability. Great, thank you. So I am going to, well, I guess I've already started out by positioning myself, but start out my remarks by highlighting some media clips, some headlines of women who have given birth alone in their jail cells. As these are all from the last 5 years. We don't know how often this happens, but the fact that it is a non-zero number is deeply problematic, deeply troubling, and represents a long legacy of the devaluation of the bodies of people of color and their reproductive capacity. And it shows systematically how disregarded the bodies of people who have the capacity to be pregnant are by our nation's carceral system. And one of them, these are all troubling instances, but one of the most graphic ones was of Diana Sanchez, who is a woman who was confined in the Denver County Jail, and her jail birth, was captured on the jail's video surveillance footage. And you can see just the systematic disregard of her complaints of labor pains, of her repeated requests for help, and no one came in until after she had delivered her own baby. And I want to contrast that with a perspective from a woman whom I call Evelyn. And Evelyn is someone I came to know when I worked at the San Francisco jail and conducted ethnographic field work. And Evelyn had been in and out of jail for most of her adult life. She had spent much of her adolescence in and out of group homes, foster care, and juvenile detention. And Evelyn had been pregnant. She had had 2 children before and had been in jail at various points during those 2 other pregnancies. She did not have custody of her 2 other children. One of them had been adopted and the other was being cared for by a family member in the area. But she did not have custody and did not have a close relationship with that child. She was pregnant again, and she was in and out of jail during her pregnancy. And when she came back, when she was 32 weeks pregnant, she said, "You know, everyone says I got arrested, but I got rescued. I was so sick, I didn't want to get high no more. I just wanted to be in jail where I knew that I could eat, I could sleep, and that even if it's not the best of medical care, I was going to get some type of care." And Evelyn's commentary is tragic and also troubling. And it's quite a contradiction to the experiences of women like Diana Sanchez. But what I think that the contrast shows is that pregnant people who are incarcerated, what defines their experience, well, many things define it, and I'm not the one to define it since I haven't experienced it, but what characterizes so much of their experiences are incredible devaluation, not only while they're incarcerated, but while they're in their communities, and lack of access to appropriate care. And so I contrast these 2 perspectives, women like Diana Sanchez, who give birth alone in a dirty jail cell, with Evelyn, who felt this contradictory, strange relief of being able to access some measure of care in jail. These contradictions tell us so much about our carceral system and the way our society values and does not value certain reproducing bodies. Now, we're anchored in our conversation today by the perspective and the framework for action of reproductive justice. And Susi gave us a brief overview of reproductive justice. And we are all anchored today in the ways that mass incarceration fundamentally disrupts the core human rights principles of reproductive justice and results in reproductive injustice. We heard about some of the founding of the term of reproductive justice, although the concepts and the incitement for action have been around for a long time in communities of color. But reproductive justice is a framework that emerged, it's an intersectional framework that emerged from and centers the experiences of women of color, particularly Black women and other people whose reproduction is systematically devalued and marginalized. And there are four key rights of reproductive justice: the right not to have children, the right to have children and to determine the conditions of birth and family making, the right to bodily autonomy from any form of sexual or reproductive oppression, and the right to parent in a safe and dignified environment and with the necessary social supports. Reproductive justice is also a structural framework. It recognizes that people need the material resources to enact these rights. And everything about incarceration and our system of mass incarceration disrupts all 4 of these rights. Our current system of incarceration, it limits people's access to contraception and abortion. In terms of the right to have children, coercive sterilization occurs among people who are incarcerated. People have limited access to prenatal care and to quality patient-centered prenatal care. And people who are incarcerated have little say in the conditions of their birth if they give birth while they're in custody. Absolutely, it disrupts people's ability to exercise bodily autonomy. That is kind of the purpose of incarceration, is to remove people's sense of autonomy. And so by very definition, that process contradicts the core rights of reproductive justice. And of course, we know that sexual assault occurs in custody. It is underreported, but it absolutely occurs. And in terms of the fourth right, the broader right, which really is everything in our society, mass incarceration, it separates parents and children. So it disrupts people's ability to parent. It suspends people's parental rights. And so when they return to their communities, reunifying with their children can be very challenging on a legal as well as social and psychological level as well. The over-policing of communities of color absolutely disrupts the abilities of people to parent with dignity and in safe environments. And all of the billions and billions of dollars that are funneled into our institutions of incarceration, that is money that is not going towards building strong communities, quality education systems, especially for communities that have poor access to quality education, and a variety of other social and medical supports. So everything about our system of mass incarceration and the fact that it disproportionately incarcerates people of color is contradictory to the tenets of reproductive justice. Many of us are familiar with the historical and racial context of mass incarceration, and we could spend a very long time talking about this. But just for a few points to keep us all oriented, in the last 4 decades, we've seen an exponential rise in the number of people behind bars, and that has not been a proportionate rise. It has been disproportionately affecting people of color. In the late 1970s, there were approximately 500,000 people behind bars on any given day, and now that's more like 2.2 million. And that's only people who are behind bars. That doesn't even include the many more millions of people who are still under the grips of our carceral system through community supervision programs like probation and parole that are similarly infused by surveillance control, although they are community-based, but still have elements of the carceral regulation that we know happens behind bars. Of course, this is not mass incarceration, and this exponential rise is not a coincidence. It's not a result of increasing crime rates. It is a result of calculated and intentional policies that disproportionately police people in communities of color, and is an instantiation, as Michelle Alexander has so clearly and eloquently written, of Jim Crow segregation and how we hierarchicalize our society through techniques of incarceration. Mass incarceration also results from shifts in economic shifts in our society and unemployment, but it is the overarching drive in mass incarceration. Even the ways that so-called war on drugs policies have influenced it are fundamentally about white supremacy and racialized policies. We also know that this has distinctly affected women and Black women. You can see that just simply in the rates of incarceration. Black women are incarcerated at twice the rate of white women. We also see similar disproportionality with Indigenous women as well. And that, again, is not a coincidence, but it relates to the deep connections and links between our child welfare system, the so-called child welfare system, more aptly named the family regulation system, the ways that drug use and other conditions of pregnancy have been criminalized and disproportionately criminalize people of color for drug use. The myths of the crack baby from the 80s, the myths that drug use and pregnancy were moral failings and caused harm to the babies. these things have spilled over into the ways that, that Black women and other people of color, their reproductive bodies are devalued, regulated, and presumed to be not worthy of parenting, and seeing incarceration as a more apt way to manage their reproduction, which it of course is not. But all of these unique or distinctive ways that Black women and other people of color, their bodies have and reproduction have been devalued and controlled, come to bear on our incarceration system and what happens behind bars. Legal scholar Michelle Goodwin has written extensively on this, this topic and the legal history behind this as well. So in these last 4 decades amid mass incarceration, we've seen nearly an 800% increase in the number of incarcerated women over the last 4 decades. I should also note, I'm often using the term women because these are what the statistics report, but I want to acknowledge that many of the people, we are talking today about pregnancy, many of the people who have the capacity to become pregnant, of course, do not identify as women, but when citing statistics, it's reported as women. So this increase in the number of incarcerated women over the last 4 decades has been largely forgotten. And even in conversations over the last 5 years that acknowledge that we've finally seen a decline in the number of people behind bars and incarceration rates, that neglects and elides the females who are behind bars because it's only true for men. It's only until very recently, until the most recent statistics that came out about 4 weeks ago nationally, that we've finally seen a small decrease in the number of females behind bars, a very small decrease, but mostly that has been for men. And it's estimated there are over 218,000 females behind bars on any given day. Most of these women are young women of childbearing age. Most of them are mothers to young children. And so that has a ripple effect on the families, children, and communities they leave behind. Most women are arrested and charged with minor level misdemeanor crimes. That in no way is to say that people who are charged with more serious level crimes do not deserve adequate health care. It does not mean their reproduction is not valuable, but it's just to say that many of the reasons that women are incarcerated have much more to do with the ways that their lives are structurally marginalized in the community and not because of them being dangerous threats to society. So we're talking a lot today about pregnancy and childbirth for people who are in custody. And so we should try to have a sense of the scope of this. How common is it? Well, until very recently, we actually had no idea. There were no systematic studies of the number of people who were behind bars, who were pregnant or who gave birth. There was no federal agency or even state agencies that were charged with collecting these data. And this lack of data, I think, signals just how systematically disregarded pregnant people's bodies are in custody. And I see this in a way as women who don't get count, women who don't count, don't get counted, and women who don't get counted don't count. So if no one's paying attention to how many people there are, people just assume it's not a problem and don't tend to the pregnancy specific needs that people have. And that replicates the cycle. Our research team at Johns Hopkins conducted a study where we did collect these data for 1 year from a sample of 22 state prison systems, all federal prisons, and 6 jails, including the 5 largest jails. Minnesota was one of the prisons that participated, thanks in part to the connections that Rebecca Schlafer helped us make to encourage them to collect and report these data. And I understand that there are ongoing data collections as well, but these data come from the time they reported for the study. So what you see in the infographic is the national data. In our study, there were nearly 1,400 admissions of pregnant people to these prisons and nearly 800 births that happened, 800. And this is just at 22 state prisons and all federal prisons as well. We found that there were pregnant people who had opioid use disorder, and many of them were forced to go through detox and didn't have access to treatment. We found that very few prisons and jails provided access to breastfeeding supports, but some of them actually did. But very few women, even in these places where they had programs, did actually participate in these programs and express breast milk. We found that there were very few abortions at the prisons. There were only 11 abortions that happened. So that was 1% of all the pregnancies that ended, which is not proportional to what happens in the community. One of the very unique legal perspectives on pregnancy care for incarcerated people is that incarcerated individuals have a constitutional right to health care, and that's grounded in the 8th Amendment that prohibits cruel and unusual punishment, and a Supreme Court case from 1976 that determined not to provide health care was cruel and unusual punishment. But the language from that decision is very vague. It requires them to address institutions to address serious medical needs, but there's no set of national standards. There is no required accountability or oversight. And so really, when it comes to what healthcare, including what pregnancy and other reproductive healthcare services are available in prisons and jails, it just depends. Every system decides what it determines to be a serious medical need and what it's going to provide. And for so many facilities, that's really just a floor. They want to just provide the minimum of what they need to do. And that has significant consequences when it comes to pregnancy care. Studies and other reports have shown variable and limited access to prenatal care in some prisons that have no prenatal care policy and don't even have a pre-existing arrangement for where a pregnant person would go if she went into labor while she was in custody. Things that we take for granted about our everyday lives become special privileges when you're in an environment of deprivation where you don't get to decide what you eat and when you eat, where you have to ask for permission to use the bathroom. So things like having a bottom bunk, which is important for a pregnant person. We wouldn't want them to climb up to a top bunk and risk falling and the harms that might come from that. That requires often a doctor's prescription or a healthcare provider's authorization. So things that we take for granted become medicalized. If a pregnant person in custody has any symptoms, any issues, any urgent concerns, like bleeding, for instance, or contractions, they can't just call up their healthcare provider or present to a clinic or labor and delivery. They rely on custody staff as triage for their medical complaints, and they're completely at the whim of those people. And custody staff are not medically trained, and their response should always be to get medical attention. But even in that case, sometimes the healthcare providers at prisons and jails aren't appropriately trained to assess and care for pregnant folks. There's also conflict over the use of restraints in labor. And I think that's one example, although it is certainly not the only egregious thing that happens to pregnant people behind bars. It is one of the most exemplary moments of how systematically our system disregards the value of pregnant bodies, and the way that our system is so deeply gendered toward the male gender and presumes that males are sort of the default incarcerated person. Because why on earth would we think it is okay or safe, let alone humane, to shackle a person as they're giving birth or at any point during their pregnancy? Every major medical professional society in this country condemns its use and recognizes the harmful practice, the medical risks of it, as well as it being a human rights violation. And yet that's the default. We have to backtrack and work on passing laws. At this time, there are 33 states, as well as the District of Columbia and the federal government, that have laws prohibiting shackling in labor. Mississippi just passed a law that will go into effect in July. And a lot of these laws are thanks to the hard work and advocacy of some of the people you'll hear from today, including Pamela Wynn and others. And so I want to acknowledge that work, and also that laws are not enough. We know that in all of the states that have laws, shackling of pregnant people, even shackling in labor, still happens. And that's for a variety of reasons. People not knowing what the laws are, people just putting the default in place as, well, everyone's a public safety risk. Every pregnant person is a public safety risk when they come to the hospital. So we're going to restrain them until we're told not to. So misinterpreting the law, but hospitals can also be barriers. And I'm an OBGYN. I provide care in hospitals to incarcerated, and I still take care of non-incarcerated patients as well. And I know that labor and delivery units are rife with racial discrimination and racially disproportionate care, undignified, unrespectful maternity care. And that also can come to bear for incarcerated people as well. And sometimes hospital staff can be barriers to implementing these laws. So now I want to to conclude by coming back to this contrast between Evelyn, who commented on, yeah, I'm in jail. It may not be the best of care, but at least I could eat, sleep, and get some care. And women like Diana Sanchez, who've given birth alone in their jail cells and neglected. What this tells us so much. And fundamentally, even with Evelyn's comment that jail, she maybe got better care in jail than she might have in the community, that does not mean that jails and prisons are safe places for pregnant people or other people. This does not mean we should be investing in making our jails and prisons optimal places for pregnant people, because ultimately carceral institutions, they're not healthcare providers, they're not places of safety, they're places of punishment, confinement, and inherently defined by discrimination and violence. And the fact that Evelyn and other women like her could for a moment even feel a relative measure of safety, and I want to be clear that this is not everyone's experience, but even for a moment that there was something from jail, that again does not say that jail is good, prison is good. That does not say these are places for accessing care. That diagnoses the broader failures of society. If someone like Evelyn could feel like jail was a place she could get care, what does that say about our broader social and medical safety nets? What does that say about the way she was a Black woman, her identity as a mother was consistently devalued, that she didn't have access to care, that she didn't have access to parental custody rights. So we need to see this as a call to arms and as a way to recognize the connections between what happens inside jails and prisons and in our communities. We are all connected and we are all complicit in what happens behind bars. These are not institutions that are elsewhere. And so as we keep this in mind, we have to hold the two goals of action, these two goals of action side by side. We must work to decarcerate, to end our nation's over-reliance on incarceration as a means of social, racial, and economic control, and prioritize and focus that on pregnant and parenting folks. And while we are working towards that goal, we absolutely must ensure that the people who are behind bars right now get the pregnancy, reproductive health care that they need, that they're constitutionally required to have access to, and that they have dignified and safe environments until we get to that goal of not incarcerating them. So thank you so much. I look forward to learning from and hearing from the other presenters today. And I'm happy to address any questions if there's time. I see, I'll leave it to the organizers to stop me when it's time to move on to the panel, but I do want to just acknowledge the question that's in the Q&A. Is it legal to not have prenatal care policy in all women's? It is legal not to have a prenatal care policy, period. It is not required that prisons and jails have a policy when it comes to any healthcare, let alone pregnancy care, unless you're in a state where there is a law. So in Maryland, where I practice, 2 years ago, thanks to the advocacy effort of a coalition called Reproductive Justice Inside, the state legislature did pass a law that requires all institutions in the state, institutions of incarceration, to have a written policy about pregnancy care. And the reason that this can happen is because there's no oversight. There is no national system. Medicaid is suspended, so we can't use, for incarcerated people, so we can't use that as a system of oversight and compliance. It just, anything goes. This is why incarcerated people can be denied access to abortion, even though it's clearly been shown that women retain their constitutional right to abortion when they're incarcerated, but because no one's paying attention, anything can happen. I want to acknowledge that it might be time to move on to the next panel, and so I can answer some of these questions in the in written form, if that's okay with the organizers. Okay.
Yes, thank you so much, Carolyn.
Yep, and I will stop my screen share so I can see that.
Thank you so much. Hello, everybody. My name is Tion Tulu. My pronouns are she, her, hers. And I am a student coordinator at the CJL, and I have the opportunity to introduce our first panel. which is on the topic of pregnancy and postpartum in the carceral system. So a key tenet of our anti-racism framework and approach at the CJL is centering and amplifying community voices. And to sustain this, we encourage justice-impacted community members to be speakers, panelists, and moderators to our events. In doing this, we want to acknowledge how necessary it is to have individuals who have experienced and faced topics we cover not only be a part of these discussions, but leading them as experts in their own right. So with that being said, I'll pass it on over to our moderator, Tommy Franklin, who is a filmmaker, writer, producer of Weapon of Choice podcast, and founder and president of Special Menu Productions.
Hey, everybody. Thank you for having us on this Friday. I'm excited because there are a lot of familiar faces and people I really admire today in these discussions. So yes, my name is Tommy Franklin. I'm a filmmaker, but like the intersections of art and activism are kind of how I approach all of my creativity. I used to organize primarily around removing barriers to housing, democracy, and employment for formerly incarcerated people. And I've met a lot of these amazing people along that journey over the last several years. So I just want to thank Dr. Keefe and her team. I definitely want to shout out Representative Jamie Becker-Finn and her leadership on the Healthy Start Act alongside some of the amazing people doing this work that you'll hear from today. And shout out to Pamela Wynn because she's featured in an amazing short film called The Box that had its premiere in Texas and will be at Tribeca Film Festival. And some friends and colleagues of mine made that film. So a lot of amazing work, as you all know, and you'll learn about today. And I would just like to get to introducing the panel. We have some amazing folks, amazing friends in here. If everyone can we want to get onto these really good questions and answers, right? If everyone would like to, maybe if we start with Pamela and Julie and Mariah, can introduce yourself from anywhere from 30 to 90 seconds. Just tell everyone a little bit about yourself before we roll on with this exciting conversation.
Good morning, all. Thank you for joining. Thank you for having me. I am Pamela Wynn, founding director of Restore Her here in Atlanta, Georgia. I do a lot of things. I wear a lot of hats. Couldn't get it to you all in 90 seconds, but we'll get more into that. I'm ready to get into this, and I'm excited to be bringing awareness to the subject, much needed.
And how about Julie?
Hey, I'm Julie. Can you guys hear me? Can you hear me? Okay, cool. I'm Julie. I go by she, her pronouns, live in Northeast Minneapolis, practice Chinese medicine. Very excited to be here with you all today.
Thank you, Julie. Mariah?
Hey everyone, my name is Mariah Wilberg. I use she, her, hers pronouns. In my day job, I work on our statewide plan to end HIV. I live in St. Paul, Minnesota, and I am here in my capacity of a formerly incarcerated person. Happy to be here.
Hey, Natalie.
Good morning. My name is Natalie Pollard. I have been formerly incarcerated. I was a mother who experienced the disparities of being pregnant while in jail and giving birth incarcerated. I currently reside in North Minneapolis, and I have been reunited back with my children, and I was asked to be on this panel to talk about my actual experience.
Thank you. Is Cameron here? I can't see everybody's boxes. And if not, we'll keep it rolling. And by the way, I didn't mention I'm formerly incarcerated, and I was also born to an incarcerated mother. So a lot of everyone in this room, in this discussion is family to me for a lot of reasons. So I think I'll ask questions, some general housekeeping. I'll ask questions, If someone is compelled to answer the question right away, go ahead and unmute and run with it. If everyone doesn't have to answer every question, but when you're inspired to like give your feedback, give your energy. But the most important disclaimer is feel free to tell me that's a stupid question, next question. But we like to go deep, so I think we're gonna be all right. So I think, and just to set something down before I get into my first question. For starters, we're all criminals. So if no one's ever been arrested, you're a criminal too. We've stolen a pack of gum or taken something from our parents at some point. And, just think of all the times you've broken the rules and didn't get caught. And now think of all the times you may have broken the rules and did get caught. Your personality and who you really are and your true character is somewhere in between those two. So we're all quite similar in so many ways as humans. And that's how we try to think about how we want to achieve a better world. So first question, I guess I want to start at the end and work our way backwards, right? So I kind of want to start at the win, right? We know we want to end prison birth in America and in the world for that matter. So to perhaps, for some of you, prison and jail, we all know that prison and jail, prison birth awareness is not like a high priority topic when you have this new wave of excitement around conversations about mass incarceration in the last 5 to 10 years. It's not the top. Like if you ask people who do the work deeply in all of these facets of mass incarceration, and the experts that don't include us, and you ask them what their top 5 issues are in mass incarceration, 0% of them will mention prison birth, right? And so we're obviously fight to bring that awareness and bring that truth out. Not only that, like we want ending prison birth to be a #1 priority. So why is that important to you that we prioritize that?
It's important to me that it's prioritized because I experienced it. I was pregnant when I was incarcerated. I served a 78-month federal sentence. And during that time, I was detained at a private prison that contracted with the feds. And as part of their contract, verbatim, they told me that I had to be shackled every time I was transported back and forth to court, because at that time, I had not been convicted or sentenced, and I was going back and forth to court. Although they knew that I was pregnant and that I was at a facility that could not adequately care for me, they still refused to give me bond where I could go home and take care of my own health concerns. And during the time of being transported, I was shackled by my ankles, as well as a double chain around my waist that was black boxed to my wrist cuffs. And stepping into the van, I fell. And when I fell, there was no checking on me, sending me to medical, any of that. Just scoop me up, throw me on the van, go to court. Returning, still no medical care. I began bleeding, spotting, all of these different things. I'm sending in medical requests to medical. They were ignored for over 2 weeks. Finally, I got a response that told me it was normal for pregnancy. Prior to my incarceration, I was a registered nurse, with my specialty being women's health. So I was happy to inform them of my background and my professional experience, and that was not normal. At that time, out of professional courtesy, as they told me, because they were my colleagues and we had other colleagues in common, they wanted to be frank with me and tell me that the institution was built for men. They did not expect to have women. Definitely did they not expect to have a pregnant woman. There was nothing there they could offer me, not even a prenatal vitamin. They had no contracts with obstetricians or anything. The doctor that was working there, her specialty was family practice, and she said she had absolutely no clue what to do with me if I was experiencing any problems with my pregnancy. They didn't know what to do. So in turn, they sent out a request to the marshals to take me to the ER, and the request and approval turnaround time was 4 weeks. So 4 weeks later, we got approval. Now this has been about 8 weeks since it happened. And we go to the ER. we're looked at like we have 100 heads because it's 8 weeks old. It's no longer an emergency. And they're told that I need to see a perinatologist because now, because of the fall and the bleeding, it's a high risk pregnancy. I was taken back to the facility because they were only approved to take me to the ER, which meant another request, another approval, another 4 weeks to take me back out. We did this a number of times because I went to the obstetrician. She needed an ultrasound. So there was another request put in for an ultrasound, another request to read that. So we're talking about 16 weeks. I eventually miscarried. So that is why we must get something done about this. And that is what transpired me to do the work, because even coming home, I was told repeatedly that there was nothing that I could do.
Thank you for sharing that, Pamela. And anyone else want to touch on why they think it should be a priority, this issue, and tackling it and, fighting for these truths?
It's humiliating. Listening to Miss Wynn, this is a very touchy subject for me, and I like talking about it though. I remember when I was going to prenatal appointments when I was in Ramsey County Jail, and they handcuffed me, and it was a guard that had to hold my arm to make sure that, I didn't trip or fall because I had flip-flops on. I don't recall being provided a coat, and I was going to appointments in the wintertime. And going into the clinic, I had to be taken up like a back stairwell. There was no elevator for me. I had to take all the steps, to get up there, and making sure I didn't fall. I was handcuffed, couldn't really hold on to the railings and stuff like that. So I had to watch my steps, going into the clinic, and it's, women with their children getting their babies examined, and little kids, and they see they got these two correctional officers and this big pregnant woman. They pulling their babies close to them, or kind of like stepping in the rooms. It was humiliating, and trying not to cry because it's like, I'm not this person that they painted this picture of, and I'm pregnant. Like, there's nothing that I can do. I'm not running anywhere. I can't go anywhere. Why am I in handcuffs? For more humiliation, embarrassment. So I sit in my appointment, still handcuffed. The only time that I was able to get unhandcuffed is when, the doctor came in, and one guard had to always be in the room to examine me, to check my pulse, to get my blood pressure, to check the stomach, stuff like that. And then soon as the appointment was over, okay, we need to handcuff you back. And it's just like, that's the most humiliating feeling that, I'm saying, as a woman and being pregnant, that one can experience. That I know that doesn't happen anymore. At least now, I don't think it happens in Minnesota, but I'm sure, of course, in other states and jails and stuff like that, that happens to women being shackled, probably the ankles and the arms, the hands as well. That needs to stop.
Yeah, thank you, Natalie. It's really important that even when we pass some legislation and we celebrate these victories, and it may or may not get reported on, usually not. It's important that, like, we get to know the women, the mothers, the people birthing inside, because you bring up statistics, and you can simply shock people with statistics. But the legislatures and old white men who run this country hear the statistics, and they don't know what to do with them half the time, because they can't necessarily comprehend that that women matter, that mothers matter, that pregnant people matter. And so I really appreciate, it's really actually hard. It's hard to like move on to ask the next question, because I guess I'm so grateful I know you all outside of just this conversation, to be able to continue to build. And I hope that even though we're going to be asking a series of questions, even though these like I could ask 58 follow-ups for Pamela, 58 follow-ups for Natalie, but I hope that people like really, dig into learning more. Like, all of this is about learning about these women and these people that we all do this work. But I hope everybody digs into like taking it upon themselves to spend time learning more about these issues. And so like still working our way backwards, and maybe Julia or Mariah want to jump on this. Speaking of victories, like what wins in this work, this prison doula work, big or small, made an impact on your existence, your spirit, and your world as someone who's experienced some of these issues?
When the Healthy Start Act was passed, you know, I'm sorry. When that was passed, I was crying because it gives, you know, women the opportunity that I didn't have to get out, and or they can have their babies with them, you know, and not have to worry, not have to wonder, not having to, you know, have a baby in the hospital and then you got to turn around and give it to a family member, or somebody from protective services got to come pick the baby up. It gives a woman the opportunity to still have that bond while she's still, you know, doing the time that she's supposed to do. But it also helps with the postpartum. It helps with the security, you know, of a woman knowing that her baby is okay because she's still with it. Being able to still get treatment after, you know, postpartum care, you know, from the doulas and stuff like that. Just the whole aspect of just still being able to have her baby, and still be able to do the time that she's supposed to do. It gives that mother that opportunity. And I couldn't sleep, and I just was so happy because it's like I'm vicariously, you know, experiencing this through other women, you know what I'm saying? Like I said, for opportunity that I did not have. So yay. For that act to be passed. And I actually sat, you know, in the like the online court when, you know, everybody had, you know, agreed or whatever they say to help pass that act. And I had to like mute my video because I started crying because I was so happy that that's the opportunity that women get to have now coming in, being pregnant. So, you know, God is an awesome God. Sorry.
Well, for me, the most recent win for myself was with Mississippi. I was actually blown out of the water because I didn't think, on my first visit to Mississippi, first of all, I never wanted to go there. I'm from Georgia, and so Georgia is enough. So I've never wanted to even experience Mississippi. And when I did, I felt like it was a third world country. So for them to pass the Dignity Act in Mississippi was like mind blowing to me. I was very excited about that and happy that they are to a point where they are listening. It was signed a couple of weeks ago, last Saturday, I believe, and will go in effect July 1st. And then last Tuesday, I was on a press conference with North Carolina, who I've also been working with. And the strategy that I helped them create not only shut down the sheriffs, but the sheriffs are now supporting the dignity legislation there. And so they should sail straight through. I'm just waiting to hear that it has gone through legislation and passed. But my actual first victory was with the First Step Act. I was fortunate to be able to write the language in the First Step Act around women who were incarcerated, and to be in the House when it was being voted on, the final vote, and to hear Representative Karen Bass tell my story, my personal story on the House floor as to why they should pass the First Step Act was like very surreal for me. To sit there and hear her speak of what happened to me, like I had actually met her and told her myself verbatim. And all I could think about was sitting in the cell, because after my experience, I was placed in solitary to relive that moment over and over. And during the time that I was miscarrying, I was shackled. I had 2 male officers between my legs that refused to give me any privacy, and they threw my baby in the trash. So to just have to repeat that thought over and over in solitary, I remember just thinking I wanted to die. They were trying to destroy me. How do I come back from this? This has to be the lowest point in my life, to actually sitting in the, in Washington, D.C., in the House of Representatives, and being in that moment and watching that screen and seeing that bill pass, and knowing that I had, when I was told there was nothing that I could do, I had actually did something that would impact every woman that I left behind. And like you, I remember I wanted to scream, and I asked Van Jones, if I scream in here, are they gonna lock me up? And he, just told me, do whatever you want to do. You got a whole team of lawyers here, and, we'll take care of you. And then from that, when it really motivated me to come back home to Georgia, my home state, where they had been working on this legislation for over 10 years. And in the 1 year that I worked on it, I was successful in getting it passed. But Natalie, unfortunately, although I have been a part of at least 15 states passing shackling legislation, we have these laws in place, but they're still being broken. It's still happening, even though the laws are in place. This year, I wrote a law very similar to the Health Care Act, but mine is called the Women's Care Act, and CARE is an acronym for childbirth alternatives, resources, and education. And what it does is very similar to what you all have there in Minnesota. If a woman is arrested and has not bonded out within 72 hours, and she must receive a pregnancy test. If her pregnancy test is positive, they must release her on bond, whether they want to or not. It's not a question. During that time, if she is convicted and sentenced to serve time, her sentence is deferred 6 to 12 weeks after she has her baby. Unlike Minnesota, we don't have halfway houses here in Georgia for women. So these women will be at home and be able to take care of themselves. And I like it because, like you say, they'll be able to spend time with their babies. They'll have a say in their own medical care, their own nutrition, everything about their pregnancy. They will be 100% hands-on, as they should be, making those reproductive choices for themselves. It will also, here in Georgia, once you deliver your baby, first of all pregnancies are induced. There is no such thing as a natural childbirth if you're incarcerated in Georgia. And that's an issue for me. And then when the babies are born, you get 2 hours with that baby, hopefully at max. And then it's taken from you, and then you have 24 hours to say where it goes. So with the Women's Care Act, at least this way, they will have ample time to make arrangements for their baby and know where their baby is. So like you said, they won't be in there anxious about, is their baby being cared for? Where is their baby? Losing their parental rights. I mean, imagine doing time not knowing where your baby is, if the person that has it, even cares about it and is taking care of it. And then when you get out, you still got to fight to get your rights back and look for your baby. That's insane. So the Women's Care Act will eliminate that. And I'm very happy for your victory in Minnesota. It gives me hope here to get it passed here. We did actually unanimously pass the committee hearing, but we ran out of time before session ended. So I plan to come back strong next year and get it done.
Yeah, thank you. Mariah?
Yeah, one of the wins that I'd like to talk about is when I was incarcerated. So a little bit of backstory about me. I did not experience birth during incarceration, but I was incarcerated during the postpartum period. I learned at the age of 34 that I am living with bipolar disorder that went undiagnosed through all of my decades of system involvement. And looking back, I understand that I was experiencing postpartum depression, if not postpartum psychosis. But I was misdiagnosed as being antisocial with a personality disorder while I was in the county jail. And then my experience with parenting was when I was incarcerated in the prison. I learned that my daughter would be adopted out to strangers, and I no longer was able to keep into any contact with her. So I haven't been able to talk to her since 2011, the birth the adoptive parents won't talk to me. And one of the most inhumane things was getting that phone call that I would no longer be in my daughter's life, and just hitting the floor, screaming and crying, the worst grief I've ever felt. And in Shakopee, we couldn't touch each other. All touch was outlawed. High fives, touching hair, pat on the shoulder, a hug. And it was the most dehumanizing experience to not be able to get that support I needed, or to give that support to other mothers who were grieving. Because when I was grieving, everyone around me felt that. They were all grieving with me because they were all going through similar situations with their children. But a couple of years ago, we got that no touch policy repealed, which was being incorrectly, discriminatorily applied, because in all the male facilities, they allowed for casual touch. But in Shakopee and Shakopee only, it was classified as a sexual misconduct, because of course, women can't touch each other without it being sexualized. So that was a win for me personally. And the reason I do this work, to the first question, is I want to fight the stigma. We are not bad moms. I am not a bad mom, even though I lost custody of my child, even though my child is no longer with me. That was out of my control. But that's the message we get when we're incarcerated, from everyone from my public defender, who told me I deserved to go to prison if I sold drugs with my baby in the car, from my parents who fought me for custody, to the guards and the other women. That's the message we get, is that we are bad moms. And I do this work to fight the stigma.
I fought for mine. Every day that I was sitting in Ramsey County, that Ramsey County was trying to put my kids in foster care. And I was like, if I don't get some help or something, I am going to lose my mind in here. I am the mother of 6 children. I was pregnant with the 6th child that I gave birth to. And I couldn't sleep. It wasn't the day that I couldn't eat. Sitting in jail thinking, this county is really trying to put my kids in foster care. Kids die in foster care and they abuse, and my kids have never been abused, never. And anything that mommy could do to figure out a way in jail how to keep all her kids together. And I was going back and forth to family court, talking to the attorney, writing and trying to stay on the phone as much opportunity that I had to maybe able to use the phone, because Ramsey County at the time when I was in there was it was like 23-hour lockdown. So not only was I 23-hour lockdown and pregnant, I couldn't, get on the phone. I couldn't get no exercise. They're giving me old food. So I'm thinking, okay, I'm in a bind right now. I'm in jail for protecting myself and my unborn, and then my kids is trying to get split up. I'm like, I can't, the process of, rocking back and forth. So the mind, try not to lose it. And I fought it for months until finally Ramsey County agreed to transfer my custody over to family members in order for them to all stay together. And then I felt at ease. Okay, now let's focus on Natalie's case. Her kids is all together. She don't have to worry. But then it's like, okay, what am I going to do about this baby that I'm going to have? As my family members able to take on another child, a newborn? Now I got to think about what I'm going to do about the baby. So sitting in Ramsey County for 8 months, waiting to go to trial, waiting the fate of what was going to happen to me, carrying out a pregnancy, trying to figure out what I was going to eat. I was hungry, sneaking food into my cell, getting locked in because I had food. I'm trying to feed a baby. I'm trying to make sure I don't get sick because there was women coming in there with everything. So the importance of why it's so important, to be able to help women who are pregnant. I'm not a bad mom. Like Mariah said, I'm not a bad mom. This is a bad situation that happened to a very good person. And when you fight so hard, when you want something, you know what I'm saying, especially you're a mom, you love your children, women who protect their kids and do anything that they can to protect their kids. I am one of them. You know, I never tried to and put my kids' lives in danger. And I fought real hard from 2015 to 2017. And in October of 2017, I had went to prison. I gave birth and everything, and I appealed my case. And in 2017, October, my conviction was reversed, and I won my appeal. But I still had to get out. I got out and was approved for conditions. So being able to get out, but I was still on eggshells, being able to reunite with my kids and try to connect with the baby that I had. That was another struggle that I have to deal with. I'm still dealing with to this day. He's 5 now. Because I didn't get that, the nursing. I didn't be able to pump milk. And he's also a very sickly child. He's very sick a lot because he didn't receive nursing from me. All of my other children are not as sick as Chancellor. And that's also important as well, being able to nurse your baby if the mother chooses to. I'm still, bonding with my child, the disconnection that I kind of feel because he's been taken care of by, someone that's not his mom. So the whole importance of being able to put this out there, for other people, other legislations, other states to see that, women who are incarcerated, who are pregnant, they are not a bad mom. They might be painted that picture of it. We're not like animals in an animal shelter and stuff like that. We deserve treatment and making sure that even though if we have done something against the law, that even if we're pregnant, we still should be able to receive the care. You know what I'm saying? That we supposed to have, and make sure that, like for Miss Wynn, our mother doesn't miscarry or anything like that. Or, like Mariah, her baby got adopted out. You know what I'm saying? Or for me, my baby go with family members, and I'm having this tough time connecting still with that child. You know what I mean? So something, putting out that awareness. You know what I'm saying? It has to be spread, not just here in Minnesota, but it has to be spread around the country as well.
Yeah, thank you, Natalie. So I'm going to kick off my next question with Julie. And I think Julie, of her spiritual being, will love to tackle this one. But before I do that, this isn't a meditation, but if everybody you don't even have to close your eyes, just take 10, 15 seconds just to breathe, y'all. Everybody who's in this Zoom or Facebook, just breathe. And also shout out to Autumn Mason. Shout out to everybody watching. Yeah, this is pain to passion, as someone commented. It is cruel and unusual punishment. It is unconstitutional. So again, the more we can get more women and Black and brown women, and just way less old white men making these laws and passing these laws, we're gonna get there. So again, this is to everyone, but let's get Julie let's get Julie in the mix here. So I want to know, y'all are incarcerated, whether it's postpartum, whether it's during your pregnancy, and all of that. When you're inside, when anyone's locked up, but it's, specifically to this issue, we have to fight even to sometimes find moments of calm and peace. So when, whether the sun was shining that day, when did you feel beautiful? Now, this could be physically beautiful, spiritually beautiful, whatever comes to mind. Now, there's obviously many moments of sorrow and anger, but how did moments of calm wash over you while you were incarcerated and pregnant or dealing with postpartum? Julie?
Good question. Well, so just a little bit about my story is that I was arrested and convicted in 97, served a year, and found out I was pregnant was supposed to go to the Challenge Incarceration program. So I was at Shakopee, was supposed to go to CIP boot camp, found out I was pregnant, and I had to make a choice whether I wanted to remain pregnant or terminate my pregnancy, go to boot camp, and serve only a year sentence as opposed to 3. So in my mind, I had to choose between my child, who was 3 at the time, and whether I wanted to get home to him sooner, or whether I wanted to have a child in prison and, let my mom raise this child and not be with this human for 2 or 3 more years. So I chose to have an abortion and had to pay for my abortion, and, went to Planned Parenthood and was shackled and chained and, the whole deal, and sitting in the lobby with all the other pregnant people. We're all there for the same reason, and everybody's looking at me like, this sucks, and wow, this really sucks for you. And I was like, yeah, I know. And so, one of my proudest moments was being involved in the anti-shackling legislation, because when I was there and having an abortion, the correction officer did not want to remove my handcuffs or my restraints at all. And I had the most amazing and compassionate OB who refused to do the procedure until he left the room and completely gave me mobility of my body, that was probably the most healing moment of that pregnancy and that termination. Honestly, because I felt like, rather than hearing the messages that all 3 of my wonderful colleagues on this panel have said, we get the message that we're bad mothers. We're bad mothers. We hear the messages of like dehumanization, shame, isolation, humiliation. And in that one moment, this provider held my hand as, I could hear like tissue and blood leaving my body. She just wiped my tears, held my hand, and just told me it was going to be okay. And that was really beautiful. So I think part of why I'm here and part of why this work moves me is that we need to empower other birthing people, mothers, families, that the stories we're being told about ourselves are lies. We are good mothers. We are good parents. And I find meaning in that. The other, I guess, moment of respite and peace for me was being at boot camp after serving 6 months at Shakopee and then did 6 months at boot camp. I had to learn to run. I was in a boot camp program with 80 men and 4 women. I was the only woman that made it through the whole program. And I had to learn to jog. And I'd never jogged in my life. I have asthma. So I learned, oh yeah, I can do this. So that was a bit of empowerment that I took away from that.
Would anybody else? Okay.
Moments of peace for me were when I was writing, because for me, writing is healing. And I had to, my first part of my incarceration, I was getting better for Amari, my daughter. And because I thought I was going to get out and parent her. And I had to come to a new understanding that I had to get better for me. And by doing that, I was also being the one to break these generational patterns in my family, with my mother being in my biological grandmother getting her children taken away from her by the courts. So that moment of a lot of pain, but some peace, was knowing that even if I didn't do it in time to raise my daughter as I wanted to, I know that when she comes back into my life, I will be a healthy person, and that I am taking the steps to finally break these patterns and see something new.
I'm not racist, I'm not prejudiced, but I'm going to give you an example. When a mother who was like a slave and she gives birth to her baby, sometimes, to be spiteful, sometimes the master would come and take her newborn baby and sell it. And she's crying, and she doesn't know what's going to happen once that baby has been taken from her. That's how I felt when I had my baby, and I had to put him back in his bassinet thing, and the nurse had to wheel him on to the nursery. So I'm watching my little baby that I don't even know what he looked like, or, the opportunity to see him more and hold him more and smell him more. And just like, damn, I just did all of this. And now I have to watch my baby go with other people and keep his smell on the blanket that my doula let me have. And got back to the facility, and you get back there and it's like, damn, I just had a baby, and like, what do I do now? We're gonna send you to medical and then you go back to your unit like it was nothing. The next time I didn't see my baby, till he was 3 months, and it was a surprise visit. And I got a call, Pollard, to the staff desk, you got a visit. And I'm like, oh, okay. So I didn't feel good on the inside, came where I felt ugly on the outside, the clothes we had to wear, my hair, you know what I mean? I'm suffering from postpartum. So I put my clothes on and I go to visit. And when I go to the visiting room, what made me feel good about myself is that with my kids, it was 3 of them. Mommy! They ran, and that I couldn't run. I couldn't do anything. I had to stand there because, the CO is watching you. So the kids run and they hug me. And then my mom comes in and she has this little baby wrapped up in a blanket. And I'm like, oh my God, I get to see my baby, because I hadn't seen him. I didn't know what he looked like or anything. So seeing a newborn baby, and then 3 months go by, you wonder, what does he look like? Can I get some pictures or anything? And she brings him, hands him over to me, and I move the blanket off of his face a little bit. I'm like, oh my God, this is a little guy. Like, this is a little person. He's so handsome. Like, wow, I did all of this in jail. I struggled. I locked up in a cell and fought for child, to keep the kids together. And this is the outcome of how good my kids smelled, how clean their clothes was, how good he looked. And he was just like brown, beautiful little baby. And I was proud because I did this. I made sure that mommy did everything that she could to keep herself together and made sure that she had a healthy 7-pound, 10-ounce baby. And when I left the visiting room, I still smelled him, because out being in the population, there's like, women, and there was some, hygiene and stuff like that didn't smell too great. So still being able to smell that baby on me, on my clothes, and everything, it was just like, oh, I got to hold my baby. But then I get back to my room and it's like, my baby. So having to battle with knowing that I don't get to see him that much, but the fact that I know that he healthy, he didn't have, he had everything, you know what I'm saying? His skin, everything made me feel I did a good job. Good job, Natalie. Your baby is beautiful. You did a great job. And look at your other children. That's what you need to get home to. So stay focused. Do what you have to do to get home to them kids. And that's exactly what I did until I wasn't satisfied. I wasn't, I didn't feel beautiful all the way until the day that I was granted conditional release, and the surprise that I made for my kids when I popped up at the stairs at my parents' house. And my kids had no idea that mommy had been released. the best feeling in the world, the greatest day of my life. And I made a point to promise them that mommy wasn't going back, regardless of whatever was going to happen, whatever I needed to do, mommy wasn't going back because I wasn't leaving them no more.
Thanks, Natalie. So Pamela, if you care to share, and you know, everybody, like we just looking at the news every day can make life unbearable, right? But we can turn off the news, we can turn off the radio. But the thing is, when we're incarcerated or even post-incarceration and dealing with all the barriers, challenges, one thing we can't turn down the volume on is our sensitivities, right? Our body. Pamela, what were some things you did to turn down that internal volume?
Well, for me, I am a victim of sexual abuse. And during those times, from the very first time, it happened 3 times, I immediately learned to separate my inner self from my body. And during the entire experience of miscarrying my baby, that's basically what I did for myself, especially knowing that there were 2 men in between my legs that I didn't know from Adam. So that's the way I dealt with everything in there. I just separated myself, my inner self, from the person that was in that prison, in that jail, dealing with all that you have to deal with there, because you never have a moment for yourself. There's always someone constantly there in your face, around you, somewhere, somehow. So the one time that I did get a shred of peace or a moment to myself was I was allowed to take a shower before I left the hospital. But even in that moment, it was interrupted by a knock on the door from the officer saying, "When are you okay? You know, how much longer are you gonna be?" And so that little moment, you know, was just disrupted then. So I didn't have that. So for me, the entire time, I was just totally angry and pissed off, and just separated myself and just kept telling myself, you know, this is the self that I need to have here. And the real me, I need to keep inside and protect and hold on to when I get home. And for me, I had a 14 and a 16-year-old son that I had left at home. I didn't have support. They were basically taking care of themselves. So every day was a concern that somebody might find out that they were home alone. So my moments of goodness were, you know, speaking to them daily and hearing that they were okay, that they were safe, that they were doing well, and hearing from my grandmother, who they would take the bus, because we took care of her when I was home, would take the bus to go check on her. And she would tell me, you know, when I see the boys, they have on clean clothes, they're doing a good job of taking care of themselves. And that made me feel like I had invested well in my sons. And they had taken in everything that I had taught, you know, tried to put in them, and they were doing well with it. And then knowing that they received full scholarships to college. So when I came home, they were both in college, and doing well. And like you all say, that reaffirmed to me that I was a good mother, that I had, you know, put good things in my kids, raising them alone and doing what that I could do. But that was basically how I dealt with the whole issue. I had to separate myself, my physical self, from everything that was going on around me.
Yeah, thank you. So we have about 10 minutes left, and I'll probably close it out with a wrap-up question to all 4 of you. That is going to be completely open-ended. Go anywhere you're going to want to go with it. But before I do that, I definitely want to acknowledge for the 180 people in this Zoom and whomever might be watching on the Facebook Live who identifies as a cishet male, especially men, we gotta do better, okay? We gotta check our best friends, our family members, because everything that, like, we hear stories of a lot of the horrible stories of the end result, but it could literally, we gotta stop this culture, this rape culture. And there's a lot of things that get tagged culture on the end of it now in modern day society, but can we deal with the first one, you know? So men, if you're out there, fuck, like, I shouldn't cuss, but do better, okay? And I don't know my mother. I don't know, and I don't know my mother to this day, 37 years later. It's taken probably within 2 to 4 hours and put in the system, right? And I'm searching for her to this day, but we know that, I don't have the exact statistic in front of me, but the great majority of women who are incarcerated for any reason, usually a straight man has something to do with it. So please, let's do better. So to all 4 of you, you know, we're gonna wrap this up. Completely open-ended questions to all of you. There's 180 people in this room. There's people watching on Facebook Live. What do you want the people tuning in right now to know? Completely open-ended.
I want the people to know that it's still happening. There needs to be something done. It needs to be an awareness. It needs to have some voices, some more voices besides just ours here planted in Minnesota. There needs to be some changes made, you know. The fact that, you know, I get asked to talk about what happened to me because, you know, it is a reality before me, after me. I had some really support. I had some women in my life that came into my life at that time that are to this day my friends. And without them, I don't think I would have been able to pull through the way that I did in that time. Support women needed, especially, you know, fathers, men who are more or less they are capable of being able to help. That means that they don't care about their kid either. You know, women didn't have the baby, they didn't get themselves pregnant. You know, and if a woman is pregnant and incarcerated or jail and a man knows this, then he should be able to, you know, put his big boy pants on and want to step up to make sure that his kid is okay if he cares. You know, so a woman don't have to worry. A woman doesn't have to, you know, feel, you know, the way, you know, that a lot of women feel. That also needs to change. And like I said, just putting out that awareness, letting it be known that it's not happening just here, it's happening all over the country. And there's like in Alabama as well, knowing that there's people out here that are fighting to have this change made. I'm just a little speck, you know what I'm saying, in what happened. But for me to be able to be a part of the movement, that's my passion, and I'm gonna do everything that I can, you know, to help in that. So
Yes, I just want to say to fight the stigma. My entire experience with being a mother was finding out I was pregnant and living with HIV at the same time. And then I faced the stigma. Some people judge me for continuing the pregnancy because of the risk, even though it was minimal with medications. Whereas some people would have judged me if I chose to end the pregnancy. People judged me because I was in an abusive relationship and bringing a child into the world. I didn't need judgment, I needed help. Every step of my parenting journey was people judging me, telling me I was a bad mom, telling me all the reasons I didn't deserve to be a mom, but no one listened and said, hey, you're a mom who's in pain. Hey, you're a mom who needs help. Hey, you're a mom who needs resources. So please just, you all are doing the work, and thank you for the work you're doing, but really fight that stigma and check your own assumptions too. Thank you.
For myself, I'm gonna say to provide empathy and dignity and support. That's what we need. We need that across the country. To remember that we are women, we are mothers, we're daughters, we're wives, we're everything, we're all of that. Nothing different. The only thing that's different is that we're being accountable for a mistake that we made. And we do need help, as well as supporting any legislation. And another key thing that I must emphasize is data. We don't have data. Right now, we have so many of our sisters that are out there that we don't know where they are, and we don't know what they're experiencing because these carceral institutions refuse to consider us important enough to even count us and let people know how many women that they have detained in their facilities. And if we don't know where the women are, then we don't know what's going on with them and we can't help them. And if we don't know where the women are, they are definitely at the mercy of these people that work in these institutions. And God knows what is happening with them. And these people aren't being held accountable or liable for what they do because we don't know. So please, I'm grateful for a team of graduate students that have reached out to me, and we are just putting a template together and questionnaires, and we're just reaching out by networking with the women that we're in touch with on the inside and using those women to get in contact with more women and more women and more women so we can know where the women are. Because my thing is, I'm gonna know, and I'm gonna make sure that they're safe and they're taken care of. And so if that's the way it has to be, there's a way, as they say, another million ways to skin a cat. And so this is my way. So for the ones I'm in touch with, I ask them to put us in touch with more. So we build a network and mobilize the women inside to make us aware of what's happening with them so we can know what to do. They're not going to shut us out, and they're not going to keep us from knowing. They're not going to keep us from keeping these women safe and providing them dignity. And the other thing that I do, and that's important to me, is I attend any type of women's meetings, any conferences that are supposed to be about women, because we're never included in those conversations. And I'm always the person in the room that says, hi, hello, you forgot a population of women here. They're incarcerated pregnant women, incarcerated women. They're still women too, and they still have these same issues, and they need to be brought into these conversations. We must make them include us in the conversations. We must bring attention that we are here, however we can get that attention out there and however we can get that message spread. But we have to make our presence known, and that is very important as far as changing the narrative. Like Mariah says, to let people know that we are women, we're good mothers, and we're just like what they consider, their norm of what is great. We're that as well. We just made a mistake. And so that's what I would say.
Right, Julie.
Can you hear me? Because it says that, okay, good. All right. Mine is, I'm just gonna go for it. I mean, in prison birth, today, now, forever. You can hear from our stories, and you can see from our tears that our trauma lasts for the rest of our lives and the rest of our kids' lives. Some of us don't talk to our kids anymore. Our kids go to school with your kids. This impacts everybody, and incarceration and prison birth is everybody's problem.
Yeah.
That's it. That's it.
Yeah, thank you. So before we officially close out, just two things. And thank you everybody for being here, for sharing. I love being in this work with you. I will see a lot of you very soon. So some people in the Q&A want to know from the panelists, if you'd be willing to, please, if you click the to panel, address it in the chat to panelists and attendees. If you'd be willing to share your Venmos, Cash Apps, PayPals, what have you. There are a lot of people in the chat watching, and the people were asking if panelists could share their Venmos, Cash App, PayPal, if you feel like it. And then, yeah, Center for Justice and Law, Ostara, Alabama Prison Birth, Minnesota Prison Doula Project, some of our Minnesota state representatives. Thank you so much for having this. And Pamela mentioned it, like it's about like these voices being heard. You'll see very prominent US Congress people who do good work, but they'll talk about separation of families, and they're only speaking about the border crisis. But we know that separation should be spoken about on Capitol Hill in this regard. So let's keep letting the squad know, Ayanna Presley's and AOC's and Ilhan Omar's and Cori Bush's of the world, that they need to jump on our movement. And we all saw Biden address Congress a couple of days ago, and he's being applauded for being a calm presence compared to the last idiot. And sure, that's what a president should do. People criticize Biden for being boring. I don't want Tony Robbins. I want a boring president. He can be calm all he wants, but we need to still be loud, right? Anyone who cares about this issue, let's keep fighting. Let's be loud. Women, be angry, because all women's anger is righteous, all of it. And this was great. It's a wonderful way to end the week. We know it's a pandemic and it's very stressful out here for all of us one way or another. So thank you everybody for doing this. And I love you all.
Miss Timlin.
Thank you. Thank you.
I just wanted to say hi.
Thank you, Tommy, for moderating.
Thank you for helping me with my children. I'm sorry, I had to say that out loud because I just seen her leave me a message. And she know how much I love them. And I worked I was in her program at Shakopee. And I'm sorry, I just wanted to say thank you for everything. And she seen me leave when I was getting released from Shakopee. She was the last person that I saw before she was getting off work. So I'm sorry, I just wanted to say thank you because I haven't seen her in so long. Of course, we don't get to see people, in the facility. So thank you.
All right, good morning, everybody. Before I introduce our second panel, I just want to take a moment to say thank you to our first set of panelists, and thank you so much for your powerful stories, your vulnerability, and for inspiring us and being in this work with us. And like much of the sentiment of the chat, you all are great mothers, and thank you so much for being here this morning with us. For folks who have not met me, my name is Yudu. I use she, her, hers pronouns, and I am a student coordinator for the Center for Justice and Law, and I have the honor and privilege of introducing our second panel. Central to reproductive justice is the ability to make decisions about our own bodies without fear, coercion, or violence. Reproductive justice is a human right that includes the ability to choose if, when, and how to have children, and under what circumstances you will be a parent. This exposes the ways in which mass incarceration is tied to the systemic violations of human rights. To achieve reproductive justice and liberation, we must center the voices of justice-impacted folks and work to dismantle mass incarceration, the main driver of reproductive oppression in our country. For today's panel, we have the opportunity to hear from our moderator, Dr. Rebecca Schlafer, Assistant Professor of the Department of Pediatrics at the University of Minnesota and Research Director of the Minnesota Prison Doula Project, as well as many other great panelists. So without further ado, I'll turn it over to Dr. Schlafer to introduce our panelists.
Thank you so much. And what an amazing group of panelists that we have today. It's so nice to see some familiar faces and some new faces. I know all of the full bios with all of the amazing accomplishments were provided. So I'm actually going to turn it over to our panelists to do a quick introduction of themselves and ask and share what they want to share. In addition to asking this very first question, we can just take it in order, and maybe we can start with Ms. Timlin. So if you would do a quick introduction of yourself and then answer the question, sort of what called you to this work or what called you to your current position? And then maybe if you'll just pop it over to Huda and Representative Becker Finn, and then Brittany would be great.
Did you say answer the first question also?
Yeah, I'd love for you to just do a quick intro and what called you to your work.
So I'm Lori Timlin, and I'm the parenting coordinator at the correctional facility at Shakopee, which is the only women's facility in the state of Minnesota. And so my background is in corrections. I was a probation officer for years and years. And then I also worked in family court and did custody and visitation, mediation, and evaluation. And I was in a place of having left my prior job with a very young child and was looking for something to do differently. And I resonated to this position because I really wanted to work with women. And I have to say, more so than parenting and pregnancy, I was just really drawn to working with women. But I also was aware that Minnesota has been a leader in some of the programming that Shakopee has done with children and pregnant and parenting moms who are incarcerated. So I was excited to be part of what I viewed as a relatively progressive place.
Thanks for sharing that. Huda, do you mind doing the same introduction, a quick introduction of yourself and what has called you to your work?
Yes, I'm Huda Ahmed. My title is I'm the director of the Justice for All project, which is a collaboration between the Minneapolis Foundation, the St. Paul and Minnesota Foundation, and the Greater Twin Cities United Way. And the purpose of that project really is to identify an area in the justice system where these three foundations could have a collective impact. And so I am leading a community-driven process. I don't have a background in criminal justice or the justice system at all, either lived or learned, but my expertise really is around co-creating with communities. And so that's what I've been doing, is just leading in to this work and pulling in and leveraging the voices of those that are most impacted. In terms of what drew me to this work, I'm trained in public, I don't know if I said this already, but I'm trained in public health. I consider myself a public health practitioner. And just as I finished my master, I have a very personal story. Just as I finished up my master's in public health, my daughter was born, my first child, my daughter was born 3 months early. Out of nowhere, I was healthy. I was considered educated, like all the socioeconomic things that tell you contributes to better health was there. I had a stable home environment, but my daughter was born 3 months early and the doctors couldn't tell me why. And so being the type A I am, I did some research and learning that as a second generation African immigrant woman, I was just more likely to have a low birth weight preemie or have my infant or have my child die in the first year of health than my white counterparts, or even my African-born mother, which was astonishing to me. One quick little story is my daughter was born in Abbott, and then the doctors immediately there were 7 doctors waiting to take her to Children's NICU, and when I finally got there around her incubator, and I had my mother, my grandmother, my mother-in-law, and my aunt all with me, and then one of them told the others, no, it was me. I said, why don't you guys say something? And they're like, and these are all African-born women who had their kids in Africa, most of their kids in Africa.
And I said, why don't you guys say something? And they said, we don't know what to say. I'm like, well, you've collectively had at least a dozen kids. So say something. And they said, well, we've never had a preemie. So that stayed with me. And so that began my journey in equity, which led me to co-creation and the need for co-creation to dismantle systems that lead to such inequities. Thank you.
Thank you for sharing that. Representative Becker-Finn, thanks for joining us. Do you mind introducing yourself and tell us a little bit about what called you to your current work?
Yeah, so Jamie Becker-Finn, I'm a state representative. I'm in my third term. I live in Roseville and represent a couple other suburban cities. I am currently chair of the House Judiciary and Civil Law Committee. Prior to running for office, I also worked as the in-house prosecutor in the Domestic Abuse Service Center in Hennepin County. So a lot of my professional background is sort of grounded in the family law, domestic violence realm. So personally, I'm a Native woman. I'm an Ojibwe woman. I grew up in Cass Lake, so I'm a Leech Laker. And I also grew up as the child of someone who was incarcerated. One of my parents was incarcerated during my teenage years. And so, this has always been an issue that I care a lot about. And, in the public policy realm that I now work in as a Native person, sort of my whole purpose of being here is to disrupt systems and, especially in addressing trauma and historical trauma and sort of how those things play out. And so that's really what my work as a legislator is grounded in, is sort of disrupting systems and making things better for folks.
Thanks so much for sharing that. Brittany, thank you so much for joining us. Would you mind doing a brief introduction and tell us a little bit about what called you to your current work?
Absolutely. Thank you, Rebecca. Hi, everyone. My name is Brittany L. Wright. I am a social impact strategist with a company I founded called Gray Matter. We work to provide digital solutions to organizations primarily within the nonprofit sector that are interested in making a social impact. And a big part of our work has been in the public health space, in the wellness space. I'm also a certified practitioner of the Orange Method of Healing Justice, which is a healing justice pedagogy that's grounded in Black liberation, behavioral health, and wellness. And I come to this work, my degree is actually in the sociology of law, criminology, and deviance. And so I studied the system and how it fails people who look like us, right? And by learning about that, I made a pledge, and realized that my life's purpose was in dismantling these systems and course correcting and rebuilding, but specifically in the lane of maternal health and health equity. I also had a unique birth experience 2.5 years ago. I gave birth to my daughter, and we had a few complications. And I'm thankful to be here, but I fall into the Black maternal morbidity lane, where I am still dealing with the health consequences of having given birth 2.5 years ago. And so I realized that, similar to my sister on this panel, I was healthy, educated, had all the socioeconomic boxes checked. I should have been great insurance, and none of that saved me. None of that prevented me from experiencing all of the issues that I experienced in my labor and postpartum to this day. And so I created an organization or an initiative under my organization called Trill Moms, where we work to center the narrative and experience of Black mothers and by extension do advocacy for all birthing parents, and are really working to uplift our narrative and experience through a podcast, through public policy, through social support, and now through a doula training and certification program that we're building. So that is my work and how I got to this space.
Thank you. Thanks for that introduction and sharing your story. as you've shared your introductions, I'm thinking about what a unique panel this is to think about advocacy at different levels, whether that is Lori's work, working with individual moms and parents inside, or community organizing that Brittany and Huda are doing, and then thinking about Jamie's work really as a legislator and at the state level, and the capacity for advocacy at different places. And I think this is such an important piece of the puzzle of thinking about how do we move more equitable birth for everyone forward. I'm going to pitch this first question to Lori, because I think you're probably the most proximal to this on a daily basis. So and you've had a long history at the women's prison. So can you tell us a little bit about some of your observations about birthing experiences in prison, and really think about where are we now and where have we been and where might we be going?
Yeah. So I would just say it's really the most heart-wrenching thing that I observe being in a prison, and that's saying a lot, because you can imagine there's a lot of loss and sadness that happens on a daily basis. But I clearly can remember one of the first women with whom I worked, encountering her literally as she came back from the hospital, and I can't even do justice to how distressed she was, almost catatonic. Her body was engorged. She couldn't think clearly. She was in pain. Fortunately, she knew where her child was, but her child wasn't with her. And then in addition to that, she had just been searched. She was not able to immediately get the medication she needed, because it first had to be routed through health services, et cetera. There was no one with her, so she was alone. It's sort of, if you think of the things you would not wish to have happen to your sister, daughter, mother, and I have to maintain professional distance. So it was just very powerful. And I do think that the progress the changes have certainly been in the right direction, but it doesn't happen easily and it doesn't happen quickly. And so one of the big things is that you do not have control over your body when you're incarcerated. And so simple privacy is just, you can't, it isn't here. There are many times when, no matter how respectful a correctional officer may try to be, when your physical body is going to be searched. I remember how I felt and how fragile I was after I gave birth, and to think of being subjected to searches, et cetera, when you're in that state, it's just another adding on of challenges for women who already are incarcerated. So it's just it's very complex, and it definitely is its own form of trauma. And I think that what happens is that even very well-intentioned people, in order to do some of the work we do, you have to have a certain amount of cognitive dissonance around it, because I just was listening to one of the jurors who said that during the Chauvin trial, the challenge was to watch someone die over and over and over again. And I think to do something like that over many years, we're just not equipped to be able to do that. So I unfortunately think there are some needs of the women here who are giving birth that it's very hard to connect with on a human level and still be able to do the things we're called upon to do. I have a little bit of a different position, and I'm told I don't have good boundaries. So I do find that you connect. I would hope you connect on a certain level. So I guess my overall thing is that there are many, what I would actually call positive things that can happen for an incarcerated woman here in terms of food and housing certainty and reliable medical care and getting support. We have a beautiful connection with the Minnesota Prison Doula Project, which happened very shortly after I started working here. So I almost can't compare it to anything else. And it's very difficult for me to imagine not having that program. But the reality is that it can be its own, whether intentional or not, its own trauma. So I think I'll wait with some of the changes that I've seen until a later. But I think no matter how many changes we make, to be separated, to first of all have an experience which is chaperoned and restricted, and then to have to separate from a newborn, there's really nothing that we can do to not have that be an incredibly impactful experience to both the mother and the child. So thank you.
Thanks for those reflections. And I think you're right. I think that these are traumas layered on traumas for all of the birthing people inside. And I think it's important to recognize that there are policies and practices that are unnecessary and re-traumatizing, including, body searches at multiple times in the postpartum period. I'm going to switch gears a little bit for this next question. I'd like to ask Huda and Brittany to respond. How does your work or the work of your organizations advance reproductive justice? Brittany, do you want to start?
Yes, so we created a framework that we call holistic maternal care. And within that, we have several tenets in which kind of ground us in our work, but that we also like to encourage our partner organizations and other people who are just interested in this work to consider. One of the biggest ones is to center the narrative and experience of the patient, of the birthing parent, of the person who is being marginalized. For so often our voices were not heard. We weren't seen as the authors of our own experience or subject matter experts. And I think we rely too heavily on people's advanced degrees, which are institutionalized, rooted in white supremacy and exclusive of our culture and lived experience. A big part of our work in a big tenet of holistic maternal care is also centering and grounding in cultural and spiritual practices and making sure that those are still integrated into the institutions that we're often forced to integrate with. So whether that is a prison system, whether it is a hospital system, whether it is an educational system, long before we had the medical institutions and the systems that we have today, we had these cultural rituals that allowed us to bring life forth into the world. And these were deemed negative, unsanitary, spiritually deviant, or, witchcraft, all of these different things. There was a narrative that was built to make us seem as if we don't know what we're talking about, and our own birthing experiences are wrong in some way. And it's now used against us even to say that, if you do this, or if you don't abide by these parameters, then you'll be in even more harm, or, your baby could be in harm. And so they use our own culture against us as a fear tactic to be submissive to something that may or may not even truly serve us. And so making sure that we honor our ancestral wisdom and practices is a big part of our work. Also by making sure that people are able to see themselves, right? And so when we think about it's hard in a prison system to see yourself, but it matters when you have people like Lori. When I used to work in the Hennepin County Juvenile Detention Center, and so I first became really conscious to the fact that there are pregnant women behind bars working with a teenage pregnant woman, who I'd be teaching spoken word classes and writing classes and helping to my scholars to express themselves. And then they'd go to court, have a terrible experience because they realize they may be here longer, which has all of these implications for whether or not they'll be able to spend extensive time with their baby, what their birthing experience will be like, what their prenatal care will be like. And suddenly they come back into the room or to the pod, or the next time I see them, and their spirit is completely broken. Their demeanor is changed, and so what does it mean for the well-being of a birthing parent to be able to see themselves in a judge, in a probation officer, in an educator, in a doctor, in a doula, in a nurse, knowing that there are people who either look like you, identify as you do, or have a similar lived experience, that they can actually advocate authentically on your behalf and use the power and the privilege that they may have to advocate for the power and privilege that may have been taken away from you, is incredibly important. There are 9 tenets of holistic maternal care, so I could go on, but those are some of the big ones, is centering the voices of those the most impacted or closest impacted, honoring those cultural traditions, and then representation.
Thank you for that. That's really valuable. And I think speaks to something that we heard in the opening keynote from Dr. Sufrin, just about recognizing that there is so much racism baked into every aspect of the systems that are intersecting here, that are collectively contributing to inequities and really preventing us from moving forward in terms of justice and health equity. Huda, what about you? How does your work or the work of your organization advance reproductive justice?
Yeah, so my work is probably a little less direct. And what you just said, Rebecca, with the mindset and the understanding that the racist policies and practices and all the systems that shape our lives lead to the outcomes disparities that we see in birth outcomes and reproductive outcomes. And it's all justice if we can dismantle and co-create better policies and practices that are much more inclusive, then we'll have better outcomes. So with that focus, that's probably the most, that's probably the higher level approach that we're taking. That's a direct connection to reproductive justice. But if I speak a little bit more directly of the community process that we're doing right now, the panel right before us, I caught a little bit of a woman that was saying that she goes to all the women's conferences, anything about women, and just like raises her hands and says, I know you're not, it's the incarcerated women and mothers are not represented or discussed or even thought about in those types of settings. Similar to that, in our process of listening to the community and having the most impacted guide our work, one of the listening sessions that we had actually was with Ostara Initiative, and Natalie was there, and something Tommy said and that struck me. Taking a step back, one of the themes that's been emerging in our process is how dehumanizing the justice system is overall. But then when I think about an example that stuck with me that nobody ever thinks about was what Lori just talked about, and it got lifted in the listening session that I did with Ostara Initiative constituents, and it was the searches that happen postpartum. So now every time I talk about, this is what we heard, one of our themes is that the justice system is dehumanizing. And here's an example. You have a mother that just gave birth that's strip searched within 24 to 48 hours, multiple times, dehumanizing. And so what I think, going back to what Tommy said, is what he said was, if you go to some of the top advocates, activists in this space that are trying to lift up change in the justice system and are listing things that could change, it doesn't make prison births, does not make their top 10 list. That stuck with me, Tommy, and now I do everything I can to make sure here are all the themes that we heard, yet this one wasn't a theme because it's not talked about enough and nobody's thinking about it. So I make sure that even though, my leadership wants to hear what were the themes, I plug in, well, this one, but nobody ever talks about prison births. And that's probably the most direct way that I'm trying to advance reproductive justice.
Thanks for that. Lori, I see that you were unmuted. Did you want to say something in response to Huda, or did you just happen to be
No,
unmuted?
I think I'm just technologically behind the curve.
You're fine. Yeah, Jamie, please.
Yeah, so I just wanted to jump in because I think that really resonated with me. And I think I also caught the end of the last session and those comments about always saying yes to listening to women. And this is a thing that's at the top of my list. Somebody early in this legislative session asked me, what are the top 2 things you want to get done this year? And this effort and the Healthy Start Act bill that I have is one of those things. But the connection I want to make is the reason this is at the top of my list is because of Safia Khan, the government relations director at the Department of Corrections. It's because a woman within that system really worked hard to make this a priority. And she was the one that organized the visit when the lieutenant governor and I came to visit moms and women at Shakopee. And that remains one of the most impactful visits in everything I've done in my 5 years of being a legislator, to hear directly. And Lori, also, I just want to say too, it resonated with me too. I so desperately wanted to give those moms a hug. And we had been strictly told, you're not allowed to touch and you're not allowed to do. And so sort of just that dehumanization. And so I just think that's really important, that the reason we are starting to see change is because of other women lifting up those voices of the moms, and then having enough women in elected office to hear that. And so it really is grounded in the work of women, and women pushing it to the top of the list and making it a priority even when others have not.
I think thank you so much for sharing that. Huda, too, one of the things that sticks with me as one of the most dehumanizing aspects of the system is, prior to the implementation of the Prison Doula Project, birthing people would not have any pictures of their baby, right? They would labor and deliver alone, save for the 2 armed correctional officers that were in their room. And this birth would happen and there would be no one there to take pictures of that birth. And I can't imagine the pain for the women and the birthing people who came before our program to have had such a salient life event, the birth of their baby, and to have no pictures, and potentially have no pictures, and what that means generationally, right? For a young child, I think about our kids who want to see pictures of their baby pictures, right? And that's important, and it's part of our narrative. And this system has literally erased them and not allowed those images to be there. And I think that's something, in addition to the body cavity searches, that has hung with me for more than a decade of this work now, about just how dehumanizing and all of these little micro ways that put this horrifying picture together. Jamie, I want to come back to you for this next question. And can you talk about how you have been centering the experiences of the most impacted people in your work? I think so often we see legislators as these very distant, untouchable people. And I always try to tell people that I work with, they're just humans. They're moms and dads and neighbors. In your work, how do you get proximal to this issue, and how do you center the lived experiences of the people who are most impacted?
Yeah, and I just want to say too, so I've always made it a point as an elected official to demystify who we are and what we do, because I think that keeps people from reaching out to us or thinking that we're going to care about something. And especially now as a chair of a committee, it's I actually have real power and real control over at least a part of my world and my job. And so it's making a point to make sure that we had hoped to actually have a video testimony from moms. We weren't able to do that, but we were able to have some letters read with some photos, and really centering it around that. It's always a balance in this work, because at the end of the day, I have to convince people who have a different worldview and different value system than my own. And so, politics is always sort of this dance of grounding things in your own values, but then speaking about it in a way that you can get other people on board with you. And so one thing I did want to make sure that I talk about we've been thinking about in this space too, is sort of that, in that dehumanization, the path to getting support from other, in a bipartisan way, in a bicameral way, has really been to center it to talk about the babies and to talk about, and there's certainly like a racist side to that, because, once those babies are like Black boys and Black men, then they become something different to these folks. And so I'm fully aware of that, but at the same time, it's babies are not threatening to people. And when you really talk about so a lot of what I do is both centering the mom's experience and talking about, when I've presented the bill and I talk about it, I walk through and kind of talk to as if, because I'm a mom, I've birthed 2 babies, and I sort of walk through as if I'm talking to another mom. And, getting people back into their memory and back into that part of them where they're remembering what it was like when their babies were born, and then imagining what it would be like to not have a loved one in the room, to not be able to hold that baby, to, I know for me, when they tell you it's time to leave the hospital, you're like, what, already? And to imagine that baby isn't going to come with you, and so really grounding it in resonating with people personally in their own experiences and making those connections. But I think, as a public policy maker, it's a lot of like talking about babies and children and how we are just perpetuating those cycles of trauma. And if we want those babies to have the best chance, which we all say that we do, then the way we're doing it is failing them right now. And so that's the other piece of it that I talk about a lot.
Yeah, I mean, it seems to me that the strategy that I hear you saying in terms of like reaching other moms about this personal experience is really effective. When you think about really trying to reach, and I'm thinking, the majority of the legislature as white men, where do you meet them at? How do you get them there? And sort of what are some of the strategies that you've learned in terms of getting to this issue?
Yeah, so again, it's part of it. And this is the part of politics that like, it doesn't feel good, but it's what works. But I mean, ultimately, a lot of times you end up having to like bring your argument back to money. And, you talk to people where they're at. And if it's going to save the system money, and also is the right thing to do, then like it's okay to resonate with folks that way. The other thing that we've done is really intentionally, and again, this was with Safia Khan and her work and her advocacy regarding this was, so we have this bill is the first bill in legislative history where all 35 authors were women. And so for women to be united on this from both parties has been incredibly powerful. There are more women in the legislature than, there have been historically. And even though many of those women may be on the other side of the aisle and have sort of different value systems than I do, I think moms can connect, and I think parents can connect. And I think the force of that many women being on the same page is hard for our white male colleagues to ignore when we're all so grounded in seeing why this is important. And I mean, it resonates with folks who are very pro-life as well, especially when you talk about those babies and you talk about a good start for a baby. And so, that's sort of leveraging women so that we cannot be ignored has sort of been one of the strategies to bring more attention to this.
Thank you for sharing that, Brittany. I see your hand is raised, and Laura, you too. Brittany, you want to go ahead?
Yes, thank you. I raised my hand as soon as you said, recognizing how many white men sit in these positions of powers. I frequently testify for Bill HF 660, which is the Dignity in Pregnancy and Childbirth Act, authored by Representative Richardson. And I'm the testifier. It's not my bill, but I come in to share my experience. And this bill, we made sure also has inclusive language to support our mothers who are behind bars as well. And I am appalled at the feedback that's given. I can completely tell my birth story and my health journey and how horrific it is. And then Representative Richardson or Rachel Hardiman will share her brilliant research that is like widely revered across the nation, but in a hearing, you know, amongst our elected officials, it is deeply scrutinized of like, well, what did the mother do? And well, you know, isn't domestic violence a big determinant of these disparities? And there, all of this blame is placed on the birthing parents. And so one of the things that I do is make sure that I point out the historical place that brought us to this point in the first place. You know, the founder of obstetrics and gynecology, Marion J. Sims, who is like really celebrated still somehow in the medical industry. Yes, he made lots of wonderful advancements, but he did it at the expense of enslaved women of African descent, you know? And so when we talk about the means to how we get here, the recognition of the granny midwives and all of these other cultural birth practices that were eradicated, and we look at the prison industrial complex, all of these things, they're interconnected, right? And so I think it's really important when people try to deviate from the issue to allow them to recognize, or when they're trying to place blame, to recognize like how we got here in the first place. So even if there are, you know, drugs or violence or any of those things that may have put a person behind bars, statistically, when we look at the population of the state of Minnesota or of the United States, and then we look at statistically who was behind bars, that's set up by design. You know, so we, you know, yes, there is personal accountability in our decisions, but would our birthing parents have to make these decisions if they weren't set up for failure in so many different ways, right? And, you know, how do you eat an elephant? It's such a weird analogy, right? But it's like bit by bit or whatever. I don't like that because I'm a vegan, but the concept is like little by little is how we dismantle the system, right? And so we may not be able to completely revamp the prison industrial complex in this moment, but if you're hearing a bill and you have the ability to shift and do something better for the lived experience of birthing parents and those babies, do that. And that sets them on a completely different trajectory to in terms of education, jobs, employment, their health determinants, all of these other things. And so I think it's important to recognize like there will be pushback when you get into those spaces, and like all you can do is push back harder and with facts, you know. And that's the other thing, like if the empathy isn't enough, go back to the numbers, because they are on our side, not necessarily in our lived experience, but in advocating on exactly why these systems have to be changed in the first place.
Absolutely, right. And I think this piece about the numbers, but the stories combined, right? What are the ways in which we can impact these complex issues, giving both of those pieces of evidence? Lori, you have your hand raised.
You know, I just, Representative Becker-Finn triggered a thought about how we think of the women who are in prison and pregnant or giving birth in such an isolated manner. And I'm auditing a class right now from Howard University called Children of Incarcerated Parents. And a piece of information that I have to say, it's the first time I was aware of this, is that in schools where there is a significant number of children who have an incarcerated caregiver, the entire school's academic performance is impaired. And so it doesn't give it a causal relationship, but there are so many instances where, you know, it isn't just the mother who is incarcerated. It is a change in financial status, oftentimes a change in school, the emotional challenges for that child and the entire family. So I hope that we can move toward thinking more systemically when we're working with these women. And if it means that if people can feel empathy for a baby, I'm in support of that, whatever it is that you can connect with around this issue. But it truly is not just this one woman and some choice that she made that has resulted in this series of events. We really have to think more broadly in terms of our communities for what are we creating and how can we interrupt some of these patterns. So
Absolutely. And there's such a great comment in the chat here from the Alabama Prison Birth Project. One of their clients says, it's not just you getting locked up, the entire family is getting locked up. And I think that's absolutely right. And there we can see evidence of the way that incarceration has these ripple effects, not just across, families, but across entire communities and across generations. I'm mindful of time, and there are a couple of really important questions that I want to get to. And this one, Lori, I'm going to actually direct at you, but I'd like to hear if others have thoughts on it too. So we have layered the complexity of prison birth in this now COVID pandemic. Many of the vital programs, and this, I should say that this question is coming from the women at Shakopee who are joining us. Many of the vital programs that are at the Shakopee prison were shut down due to COVID-19. How has this impacted the pregnant people and their birthing outcomes? And what do we know about when programming is coming back? Because we're more than a year into this. There was a real public health need to shut it all down. And I'm getting impatient, if I'm being quite honest. Like, we've got to figure out a way to get services back inside. So I'm wondering if you can sort of tell us a little bit about what's going on now.
Well, I guess I appreciate, Rebecca, your statements, but I do wish that more people could be sensitive to what it would mean to not see your child for a year. And that is where we are, is that the women at Shakopee, we've had brief openings of our visiting room, but because of ongoing illness, we haven't been able to sustain that. And so again, not seeing your child for a year, that is huge. And we know so much about the benefits of visiting, even in terms of recidivism. So a little bit of a separate issue, but one thing that happened, I must say, I have high regard for the Commissioner of Corrections, Paul Schnell. I think that he has been very person focused. And when COVID became a real thing, many people were offered the opportunity to get a conditional medical release. And it was determined that pregnancy was an underlying risk factor. So the vast majority of women who are here who are pregnant were able to be in the community on some restricted level to finish out their sentences during the pandemic. So that was a real positive. We have had very, very few pregnant women since then, and I'm sort of wondering where they are. A lot of sentencing was delayed because of the pandemic. I don't know if it all can be attributed to that. So that's kind of a curiosity. And if I could tell you when it would change, no one would be happier than I. Right now, we have continued to have some cases of COVID, and so I don't anticipate it changing. Yesterday, I attended a webinar regarding how to use technology to facilitate contact. I think we can do more of that. I do not feel it is a substitute for contact with a parent, by which I mean in-person contact, nor do I feel that there just are a lot of, this format serves a purpose when there's nothing else, but I think we can only do this so long, and then things start to break down a little bit. So I'm hoping by the summer, I want to commend the women of Shakopee. More than half of the inmate population were vaccinated, and I think that's a very helpful step. So we do not have in-person classes. Again, I can't say enough about the Minnesota Prison Doula Project. They've been really creative, and we've tried to offer as much as we can via Zoom and phone. I literally, before this webinar, had a conversation with my supervisor about using technology to maybe facilitate more coached visits. So all those I think are favorable, but again, we really need for there to be some control over the pandemic so that we can open things up again.
Yeah, it sounds like it's a multi-pronged solution in terms of really responding to the true and dire public health needs, in addition to the vaccination as an option, in addition to thinking creatively and figuring out how do we get people out of the system in terms of not just conditional medical release, but you're right, like what is going to be the flow coming back in when the courts get turned back on. I think many of us who are doing work in this space are sort of simultaneously cautiously optimistic and panicked about what might happen as people flood the system. Really, really important. Okay, so we have 5 minutes left. So I am hoping that we can, each of you can answer this question in turn. What is the biggest change that you think needs to happen to improve the outcomes of birthing people in prison? Or what is one thing you would do if you had the power to change? So really this last closing question, thinking about what needs to change. Huda, can you start?
Right now, we've been doing a lot of deeply listening and really want to elevate what we've been hearing. So, and the message that I heard back related to this question is end prison births. End prison births.
Brittany, what do you think? Biggest thing we need to change right now?
I think we need to shift the way that we think about and treat our mothers before they even get into these systems. You know, so many of our mothers are behind bars. The majority of them, I believe it's like 90%, have experienced some type of like intimate partner violence or sexual trauma of some sort. And a lot of times those experiences are directly connected to what has resulted in them being in the system in the first place. And so, you know, speaking from experience, you know, those who choose to leave their unsafe households or relationships are often criminalized for doing so. And so it's like, damned if you do, damned if you don't. We need more resources for women, for mothers, instead of shaming them for their circumstances, providing them more support so that they don't make decisions or end up surrounded by people who may result in them being incarcerated. And of course, supporting our ending prison birth. It's absolutely ridiculous.
Lori, what do you think? Biggest change that needs to happen?
I have a list.
I kind of want to ask this question. I won't put you on the spot. I know you're here in your official capacity for the Department of Corrections, so maybe you can answer it from that perspective. And if you, Lori Timlin, have an idea.
So I will say I am a fan of the Healthy Start bill. I think having women surrounded by a support system in the community, and in particular, I am loving the concept of them continuing to receive services for the first year of the child's life, because there is that experience of being in a place where you're receiving a lot of support and then returning to the community. And how do you recreate that sometimes on your own? I am supportive of prison nurseries in cases where there is not an opportunity to have that woman be in the community. I do think that there are isolated cases where that is an opportunity to at least have a bonding experience with your child, to allow that child to have some consistency of care. I don't think that that is on the horizon. It's an extremely complicated and expensive, but I will say I can see instances where that would be a fair solution. And then lastly, I think we really need to be more open to partnering with community organizations. I think we're really missing the boat on, first of all, community-based is significant for the women. And secondly, having some continuity from incarceration into the community, but also being open to the possibility of perhaps agencies coming in to the facility and just being more on board. There's a lot of security concerns about that, but I do think it's a really critical piece that we haven't done a very good job of fully utilizing.
Absolutely. I think those are really important points. In our last minute here, Representative Becker-Finn, what is the biggest thing you think needs to be changed?
So obviously I got to put in a pitch for the Healthy Start Act, and the chief author of that bill in the House. We did pass the bill off the Senate floor, so we've got about 2.5 weeks. So would just encourage folks, we just need to get it scheduled for a vote in the House, and then hopefully we can send it to the governor's desk. So I just put a link in the chat. If you click on that, you can fill in your address and it'll connect you with who your elected officials are, who your legislators are. So that's super important to me, as well as there's another bill that I'm carrying, the Minnesota Rehabilitation and Reinvestment Act. And that's sort of the first step, I think, in starting to reframe the way that your average Minnesotan thinks about the Department of Corrections and what our role really is and what we're actually trying to accomplish. I think more broadly, within the policing discussion, within all of these discussions, sort of like decriminalizing things and really thinking hard about, we are the most highly criminalized, highly incarcerated countries in the world, yet are we safer than everywhere else in the world? And we are not. And so I think in those broader conversations, so the easy thing is like, let's pass this bill right now. And I think that really can make a difference. For folks who aren't familiar, that's a bill that would allow the Commissioner of Corrections in Minnesota to allow pregnant and recently women who've recently given birth to be in community settings instead of being within the prison setting, so that they are not separated from their babies for that first year. And the other piece of that is the majority of women who are giving birth in prison are they're released within 6 months anyway. So it's like this really stupid thing where we're separating a mom from their baby during the absolute worst time to do that. So this bill would stop that. And so again, it's the Healthy Start Act, and we're really hopeful that we can get that to the governor's desk in the next couple of weeks. So that's where my efforts will be going.
Thank you. Thank you for that. And thanks to all four of you for sharing your expertise and your wisdom and sharing space for this last 50 minutes. I feel inspired by your individual and collective work, and we've got so much more important work to do. So thank you again for joining us and sharing. We'll turn it back over to the organizers and Autumn.
Hi, everyone. Nice to see you all. All right, there's so much that I could be commenting on, but I'm gonna refrain from that and instead introduce the next speaker, who is the keynote for today. In April 2015, I was facilitating a group inside MCF Shakopee. It was a parenting group. And as everyone started coming in the group, I could feel the collective pulse was really off and panicked, honestly. And so I said, what is going on? Can we talk about it? And I remember very clearly them saying, Autumn Mason got HOFT. So HOFT is an acronym that stands for Housed Out of Facility. And everyone was deeply feeling that. So I started to volunteer at Shakopee in 2003, and the prison population on that first day was 265. That week in April of 2015, it had reached maximum capacity, which was 650 plus people living there. And they needed to start sending women to county jails due to overcrowding. Autumn was one of the first to go. The fact that such a strong leader who had so much together and offered so much to others, it honestly elicited terror in people. Women were bursting into tears and crying. Leaving the facility to go to a jail meant you could have no kid visits. It also meant no contact visits for 1 year. The women in the group had such a high regard and respect for her. They listed all the ways that she cared for and supported them, and they did not understand why she would be made to leave. I really didn't understand either, and I laid awake a long time that night thinking about their fear. And I was wondering who made that policy. And honestly, I was aching for her children who were in regular contact with her, and for her very young baby who would have to go a long time without being held in her mother's arms. Autumn Mason survived that housing out of facility experience. because she is a very powerful, gritty person. And I now have the honor to work alongside her on our team. She's a survivor of incarceration, a doula in training, and a co-collaborator in a radical revisioning of what reentry can look like for whole families that we're currently working on. Honestly, I'm crossing my fingers that she'll be the one to take my job in the near future, and I'm really looking forward to that. Autumn, thanks for being with us.
Woo, Erica, I thank you, Ray, Dr. Schlafer, Ms. Hamline, in ways that I never thought that I'd have the opportunity to express to you all. The honor is such an honor to have this opportunity to just work alongside you guys, to just advocate for my sisters who are still behind the walls, who are still struggling outside of the walls, and just to show my children an example of resilience and strength has been just more than I deserve. So I thank you for that introduction. Good morning, everyone, or afternoon at this point. My name is Autumn Mason. I'm gonna get my screen presented. Let me know if you have any issues seeing it. All right. I'm trying to get through this without any tears. This is a very emotional topic for me, and I'm very passionate about this. So as a professional, I work as a doula program facilitator and a peer support specialist with a focus on family inclusive reentry support. But I am also an incarceration survivor, an advocate for social change, and a mother of 4. It has been my dream and passion to support the families who are faced with the same nightmare that I have struggled with. The nightmare of raising a healthy family after incarceration while navigating systems that have been designed for me to fail. Today, I am excited to share this space with you all in an effort to raise awareness about the unspoken truths of what reproductive justice, or the lack of, looks like for justice-impacted families in Minnesota and around the country. And I look forward to discussing with you how we can work together to create a system that serves these families rather than harms them. See, the image on the left was taken in 2014 by my doula as I was preparing to separate from my newborn daughter reality and to return to Shakopee Prison. The picture on the right is me now with my colleagues of the Minnesota Prison Doula Project just a few years ago. I have been blessed with the opportunity to go from client to coworker. I remember the intense anxiety that was consuming me on the day that I was transferred to the Minnesota Department of Corrections Shakopee facility. I was almost 8 months pregnant, and when I was handcuffed with 3 other women and escorted from the Ramsey County Jail into a windowless transfer van. Everyone couldn't help but stare at my overwhelmingly swollen stomach. I was scared, I was embarrassed, I was shamed, and I was very, very anxious. I had over 1 million thoughts run through my head since the moment I was sentenced, but my main concern was the safety of my unborn baby. The jail was dirty, metal, uncomfortable, stale and musty. The food was unrecognizable, certainly not a place for a pregnant woman. And I couldn't even imagine the impeding dangers of a prison setting. I remember when the van stopped and the rear double doors opened, revealing the inside of the intake garage. I remember how unbalanced, unsupported, and undignified I felt through the thorough intake strip search. I could barely even bend over. The guards looked at me unforgivingly as I struggled. I remember the sounds of the overhead communication system that rang into the office, the slamming of doors, the echoing of voices, but the loudest sound in the room just had to be my heartbeat. It was especially scary as a woman, a mother, and a giver of life. The thought that I was not in control or able to protect myself or my unborn baby. I feared a prison riot or overly aggressive inmates threatening the safety of my baby, who did absolutely nothing to deserve this treatment. As I walked in the lobby of the medical center and I heard movements to activities announced, The other previously experienced offenders anticipated what was to come, knowing that the lunch movement meant lines and lines of offenders would be passing by to go on their way to the chow hall. I held my breath, expecting to see the state's most gruesome, intimidating, and evil-spirited women that I'd be forced to coexist with for the next 2 years. But as the women started to stream past, all I could see were faces. These faces were soft, maybe a little bit more worried than I expected, but they were pretty subtle. And these faces were young, old, Black, white, big, small, sad, some even joyful looking faces of women, just women. Whew. I soon came to find that these women were much more like me than I would have ever imagined. These women were mothers, daughters, sisters, aunts, and even some were grandmothers, whom all knowingly had made mistakes and were desperately wanting help and a chance to redeem their lives and reconnect with their families. They were just like me, just women. But I soon learned that it wasn't the temperament of the other women that would pose the biggest threat to my safety and health. Unbeknownst to me, it was the staff, the correctional officers, the administration, the case managers, and the medical staff, which would be worse than I would have predicted. On my first day, I received several repeated warnings and threats of discipline, including segregation, for one of the most common offenses. I continuously had forgotten that it was a no-touch facility. For simply offering my hand in an introduction with other women, I was breaking a vital rule. Can you imagine what it would be like to live without any physical contact and or passing of items from person to person for years? The fact that I couldn't hand a Kleenex to someone who was ill, or I couldn't help up our elderly grandmother who had fallen, or even hug a woman who had just found out about the passing of her 4-year-old daughter. It was completely uncomfortable, and I swear the most inhumane thing I'd ever experienced. I remember when my own family came to see me for the first time after about a 6 to 8 week application process, and they all tried to rush in to hug me. I think that was when I experienced my first anxiety attack. The visit was awkward and distant and sad to say the least. My birthing experience, it was bad. I was strip searched during contractions, supervised by correctional officers during labor, temporarily shackled to the bed, and of course, only given 36 hours to bond with my baby. But I witnessed some that were unbearably worse. One in particular will never leave me. The mom was young, poor, and lacked family support, and she was expecting her first baby just weeks after mine. We were put into the same cell together and became immediately close. I was on my 3rd child in experience, whereas she knew nothing of what to expect. Even worse, due to poor family support, she had a weak birth plan. She only knew that her mom would come and get her baby, but she didn't disclose that her mom struggled with substance abuse and sporadic homelessness. And she had over 2 years to go. Before her delivery, I tried to prepare her for what was to be expected. She was reluctant to accept the help of a doula, but she eventually did. I remember repeatedly telling her to breathe through her contractions while we were locked down one night. The guards wouldn't allow her to seek medical attention until her contractions were 5 minutes apart. Well, they would be 5 minutes apart, but then they'd be 8 minutes apart, and sometimes even 3 minutes apart. Nothing was consistent. They wouldn't call her doula until she was admitted to the hospital, and she didn't have any phone time to forewarn her mother, who lived over 4 hours away. Well, when she was taken to medical the next morning and she didn't come back, I called her mom to forewarn her that she'd probably receive a call from the hospital and should get ready to come and get the baby. I also led a donation drive amongst the women in our unit who, by dropping things off at the officer's desk, we all acquired all the necessities that she would need, like pads, underwear, more supportive bras, ace bandages to support her abdomen and her belly, body wash, photo tickets. I even remember making her a homemade baby book. We did what we could to support her in ways that we knew the facility and staff would not, which we all knew from experience. Ultimately, she did return, but she returned with over 20 vaginal stitches. Just watching her walk across that courtyard, I knew she was in so much pain. But despite the obvious physical pain, I knew that the emotional pain would be harder for her to bear. Against the policy, I gave her my phone pin to make sure that she was able to call and check on her baby, which she did at least once a week. Sometimes her mother's phone would be off. Sometimes the baby would be left with strangers that she didn't even know. I was released 4 months before her to the opposite end of the state. But thanks to social media and on a Facebook group that we have, a Facebook support group that we have created, we've been able to stay connected, as many of us do. She went on to have more children and is a very supportive and loving mother. But often we share these stories and memories that both haunt and motivate us. The trauma is so hard to process, but many of you cannot understand the ongoing struggles and pain. I cannot help but compare how the facilities are empowered with this hierarchy style of control to impose such cruel and inhumane policies, particularly toward women. Studies show that women are 80 to 85% more likely to be victims of abuse and 5 times more likely than men to have a mental health crisis. Yet, Shakopee is the only prison in Minnesota to impose the no-touch policy. As some of you may know, this has been reversed. This policy has been reversed. However, it is still questionable as far as in terms of practice and implication amongst the Shakopee administration. From my own personal experience, both as an incarcerated woman and the loved one of an incarcerated man in Minnesota, there are many identifiable conflicting policies which are only imposed at Shakopee. Women are also not offered, limited, or ineligible for many programs that are regularly offered to men. I mean, in comparison, the systemic inequities between Shakopee and other facilities, regardless of gender responsiveness, it's so remarkable. I can't help but wonder, how is it so easily overlooked? Some of the different policies that only women are upheld to that are not practiced or enforced in the male facilities are, of course, the no touching, sharing, passing, or physical contact of any form. Women are required to have more strict limitations during contact visiting. This does include with their children over the age of 12. They are not allowed to take pictures with any other women. They're not allowed to wear makeup or enhance their appearance, and they are not allowed to wear medallions or expose skin other than the arms, face, and below the knee. They do not have the same opportunities for employment, including high-paying industrial jobs and overnight jobs. Women face stiffer consequences and are penalized more often for less aggressive or threatening offenses, such as insubordination and or an unauthorized area. Women also have more subsequent punishments, such as 30 days of activity restriction after serving segregation time, and they're also not allowed to possess any electronics during that unauthorized status. One of the most common issues that we women of Shakopee faced, which is at the mercy of the Shakopee administration, is the medical care or lack of. As I have expressed in many different platforms, as I've expressed that the different prisons are run differently with particular policies and practices determined to be suitable for that particular population. So it would be expected, I would think, to have more medical services available for women, because obviously we have more medical needs and mental health care as well. But actually, in my opinion, the medical care that we received at Shakopee was not suitable for even an animal, let alone a woman. I have had an opportunity to share my experience with the medical care in numerous interviews and platforms, but the women who have been, but the women who have not been given these platforms need to have a voice. They have suffered in silence long enough. I asked the women of my support group to share some of the concerns and experiences that they've had with you. For the sake of time, I have summarized the over 37 responses to the top recurring issues, which were denial of routine gynecology services, including mammograms and pap smears, misdiagnosis and misprescribed medications, mistreatment of medical conditions, inaccurate medical history, lack of mental health services, and lack of dental services. On the screen are some quotes that have been taken from previous clients and previously incarcerated women from Shakopee. One woman who did wish not to be disclosed shared a horrible experience of being forced to have a hysterectomy at the recommendation of the facility MD. This woman was only serving a few years. She was of childbearing age. She didn't have any children, and she never knew of any pre-existing medical conditions at the time of her commit. She says she was also denied the opportunity to seek a second opinion. If you ask me, she was robbed of her restorative rights. Where is her justice, and who reserves the right to make that decision for her? So, if the purpose of the criminal justice department is to impose punishment for unlawful acts, does that person then not deserve fair and humane treatment? My focus is again to raise awareness of these injustices so that we may create a more responsible system. For the sake of society, we must also be conscious of the trauma and damage that these practices pose on the next generation. The Webster Dictionary defines punishment as a suffering pain or loss that serves as retribution. But how much pain, loss, and suffering is warranted as retribution? And as justice impacted people, do we not reserve that right? Excessive bail shall not be required, nor excessive fines imposed, nor cruel or unusual punishments inflicted. Well, I invite you to ask yourself, is denying medical treatment for incarcerated people a violation of our rights? Or better yet, for the sake of restorative justice, is denying a baby its natural source of nutrients a violation of that baby's Eighth Amendment right? I just like to highlight the case of Estelle versus Gamble from 1976, which does state that the deliberate failure of prison authorities to address the medical needs of an inmate constitutes cruel and unusual punishment, thus violating our Eighth Amendment rights. The current criminal justice system poses a direct threat to the constitutional and natural-born rights of hundreds of thousands of newborn babies and children every year by its systemic negligence and trauma. I remember moments of despair and desperation when I would hear the struggles my family was having and I couldn't do anything to help. The worst of those, however, was when I would call home to find that my newborn baby was struggling to get adequate nourishment. She had severe GERD and reflux by her 6-week checkup and had already attempted 3 different milk formulas, but nothing was working. She would be crying. No, she would be screaming in agony every time that I called, and my breast would be leaking at the sound of her cry, and I could do nothing to help her. I attempted to request to be allowed to express, store, and ship my breast milk to my infant child, which my family even offered to fund and support. The Shakopee administration declined my request. I remember one time reaching out to Dr. Rebecca Schlafer, whom I had recently been introduced to and interviewed with to support her research for medical care and treatment at the Minnesota Shakopee facility. Rebecca attempted to use even her resources to pull this off, but to no avail at that time. So my daughter and I were left to struggle with her with inadequate nourishment and me with an engorged breast and an untreated blocked milk duct, which I still have complications with today. But I do not say this to appeal for any sympathy to me or my mistreatments. I personally can admit my guilt and I accept the punishment. My child, however, should not. Who is responsible for considering her rights and welfare? Actually thinking back, not one time did my case manager assist me with any maternal responsible coordination, whereas whether that was for my unborn child or my children left outside. A study conducted by Dr. Schlafer, which, as you know, she's of the University of Minnesota Department of General Pediatrics and Adolescents Health. This study from 2018 reports that 77% of women who were incarcerated at the Minnesota Department of Corrections of Shakopee facility were mothers of minor children under the age of 18. That's 77%. Recent studies show or have begun to reveal that the imminent health threat of parental separation and incarceration for children, particularly in the ACEs study on adverse childhood experiences. As it is the mission of the United States Department of Justice to seek just punishment for those guilty of unlawful behavior and to ensure the fair and impartial administration of justice for all Americans, I invite you to now ask yourself, whose responsibility is it to protect the rights of the unborn and born justice-impacted children? As Dr. Schlafer was quoted saying in an article from the Duluth News Tribune in 2019, she makes a very good point, and I want you to ask yourself this question as well. What are the ways in which we can make sure that the justice is served without doing an injustice to the next generation? There are many different medical complications that can be caused due to maternal-infant separation, which again has been proven by the ACEs study. For infants and children, some of these implications of maternal separation can be, not limited to, physiological and developmental delays, emotional attachment issues, and self-regulatory issues, as well as digestive problems and delayed physical development. Moms also have specific implications as a result of infant-child separation, which include establishing unhealthy behaviors and or relationships, including substance abuse, as well as mental health concerns such as severe depression and trauma responses, which women like myself and Natalie can attest to experiencing. Parental separation and incarceration breeds a cycle of generational incarceration. This is a fact. As the image before you shows, once the separation occurs, and just as we've discussed, the implications develop. It disrupts not just the social development of this child, but the physiological, and as a result, the child struggles with self-regulation. That child then goes through schooling, most likely displaying disruptive behaviors and possibly being introduced to the juvenile justice system at that time. Or that child may grow to be an adult who has these same behaviors. And in that case is involved in the criminal justice system. This is not a matter of children inheriting criminalistic behaviors genetically, okay? This has been proven to be conditional and a response of toxic trauma and a weakened mental and emotional support. At this point, I like to believe that we all agree that incarceration as well as reentry is a family experience. And so therefore, there are many unspoken truths in addition to the actual times, there are many unspoken sentences in addition to the actual time served that go for a very long time and sometimes for a lifetime. These sentences also threaten the opportunity of success for families upon reconnection. Some of these unspoken sentences are employment and housing discrimination, financial instability associated directly with fines and fees, recurring systemic trauma and toxic stress associated with overwhelming programming and personal responsibility, as well as a lack of support. And something that was really difficult for me particularly was stigmatization and community distrust. Of course, there are more personally accountable barriers to success to acknowledge as well. Some of these are lack of support, untreated trauma or substance abuse, unhealthy relationships, lack of stress management skills, which are needed to sustain the stress of the above said unspoken sentences. Now, let's not be mistaken. These problems that incarcerated women face is not exclusive to Shakopee or Minnesota. Our partner organization, the Alabama Prison Birth Project, is based in Alabama, and it serves the infamous Tutwiler Prison, which was once said to be the #1 worst prison in America. Tutwiler Prison is also known for its 2014 lawsuit, which the federal government investigated it, particularly for sexual abuse by correctional officers against incarcerated women there. In the ruling of this case, several changes were determined to be needed to be made, at which time there was no parenting program of any kind for the over 800 women housed there. Since then, however, Tutwiler Prison has made many recent changes to provide child-parent relationship coordination. In 2015, the Minnesota Prison Doula Project was invited to partner with their organization to help form and facilitate their Now Doula and Lactation program. And I'd like to note that their lactation program does allow women to not just pump, but to ship their breast milk to their infant children. But my fellow Minnesotans, as I said in the beginning, a time for change has come and great program opportunities are on the horizon. As you've been told about HF 1403, this is a bill that this spring Minnesota Prison Doula Project and I have been happy to help support, proposed by Representative Jamie Becker-Finn in the Department of Corrections Commissioner's office. It's called the Healthy Start Act. This bill will allow women who are pregnant and up to 1 year postpartum to be housed in community settings such as halfway houses, where mom and baby remain together, receiving medical care, learning new skills, and creating a healthy mother-baby bond. And of course, a healthy start for baby. And as studies have shown, most incarcerated pregnant women are sentenced to 2 years or less. So this would allow most families to remain connected while serving the sentence and acquiring family inclusive reentry support. So when this bill is passed this July, just imagine how many more healthy families we will have entering our community and breaking the cycle of incarceration. This bill is definitely a leap in the right direction. So family inclusive reentry support is the ideological shift away from the current practice to a belief that successful reentry is inclusive to the whole family, including children and caregivers as parents are reentering community post-incarceration. This approach will make such an impact for so many justice impacted families, and I know it would have for mine. Reality was the only one of my children who was colic, who developed GERD, who now has asthma, who has social and emotional issues. She struggles to connect with other people, including adults or children. And she also has clear abandonment issues, as she doesn't like to be left anywhere and has a continual stream of questions for any new experience. I think of how much different she is emotionally, mentally, and socially from my other children, and I guilt myself because I know that my experience of incarceration altered her life forever at just 36 hours old. It is my dream and passion to do what I can to bring awareness of these injustices, because I believe that the people of our society would like to see a curve in criminality. We would like to see our community members be as healthy and rehabilitated as possible when they return home. And I believe that you all believe that given the proper support and opportunities, people like me can change and never return to the lifestyle that led them into incarceration in the first place, both for ourselves and for the next generation to come. So today, as I close my time with you with much hope and gratitude, I invite you to do 3 things with me. You see, I understand that like most of you, like myself, you probably had no idea what really happens behind those walls. And I'm sure you couldn't have predicted how many ways that justice impacted people and families are made to struggle and suffer. But after today, after the experiences that I have lived and shared with you in this space, you do. And the studies are out there to back up everything that I've said, but those studies have faces behind them. And those faces are women, just women. There are mothers, our daughters, our sisters, our neighbors, and they just want and need our support so they can be healthy enough to re-enter our community successfully, to be productive, to be loving, and to just be women. So I call on you, each of you, under the sound of my voice here today, to again do these 3 things with me. Step 1 would be, we have to change the language. You see, as I continuously refer to myself as an incarcerated survivor, it is because I have survived something many of my sisters are going to struggle with. I have survived a system that was meant to break me. So here I stand, rather sit, before you to say that there are hundreds more like me just waiting for the opportunity. Hundreds of incarcerated women, not prisoners, not felons, not offenders. We are women. And once we recognize the power in our words, we will begin step 2. Change the mindset. Our current system has bred a sense of mistrust toward incarcerated women and men. And if we begin to look at them as we would like others to look at us, if our biggest mistakes or bad decisions haunted us every day, then we'll maybe start to have a shift in that mindset. You see, it is called empathy. And I guarantee many more people will respond positively toward the community that responds positively towards them. We as a community and a people, and for the people of positions of power, we also have to reserve the right to hold these institutions accountable. I understand and appreciate that the Minnesota Department of Corrections Commissioner's Office is putting forth an effort to dismantle the current system and to support families. However, policy change and implementation are 2 different things. Without external accountability, we have little chance of actual change and impacting these lives. But I believe now is a better time than ever. With over 300 people in attendance here today, I know we can all promote true change, which will lead to a change in the system. I just would like to know, I cannot thank you enough for your time, your attention, and the opportunity to share this very strong passion of mine with you. I would like to take this opportunity to also personally thank Ms. Lori Timlin in a way that I couldn't imagine if I'll be able to see you again or express to you how much of an angel and a saint you are for so many hundreds and hundreds of women. Our support group, we speak of you highly often. We would like to share with you how much we care about you and appreciate you and love you. And the fact that we have so much love for a woman that we could never touch is just remarkable. But you have done so much to touch all of our lives that I am so in awe to share this space with you and to be able to publicly thank you. I'm very open to any questions or comments. And I, again, really appreciate your time today. Thank you.
Your bravery, your vulnerability. Thank you so much for sharing your truth with us. If everyone can just give her some love in the chat, love and support. Thank you. Please drop in the chat anything else we can do to support you, Autumn. Now, while we transition to our 3rd panel, Autumn mentioned you must change the system. While we work to dismantle the systems of oppression that produce the conditions of incarceration, our next panelists have stepped up as a form of active resistance. Our last panel for today is titled Prison Birth Work, Truth and Reconciliation, which brings together prison birth workers who are just some of the many frontline advocates strategically and creatively advocating harnessing the lived experiences of incarcerated people, as we talked about in panel 1, and working in collaboration with the folks and the key stakeholders, as we talked about in panel 2, to fight for the rights and dignity of incarcerated birthing people. Our moderator for this session is Erica. Erica is the co-founder of the Minnesota Prison Doula Project that has been mentioned multiple times today and is our partner today, as well as the executive director of the Ostara Initiative. Thank you, Erica.
Yeah, thanks, Ray. All right. It has been a bit of a heavy morning, but really important things I think that need to be talked about and brought to the surface. So I'm very grateful for all of the sharing up to this point. And my hope for our panel is that we too can share some of our experiences, but also start to build on this idea that we're working to create a world that we actually want to be living in, and how we, in our little tiny corner of the universe, in our own small way, contribute to creating that world. All right, so let's begin. I have Peggy, Ray, and Chantel here. And could we go around? Chantel, I'm gonna ask you to go first. Could you share, Chantel, do you wanna reflect for 1 second really quickly how you're feeling after this morning, listening to all this? We do this every day for a living, but what's it like to sit in this space and hear?
For me, it is awesome to hear the women able to share their own stories and experiences. And it makes it real. You know, like I'm able to share experiences from my level of experience, right? But having that actual lived experience, and to me, it's just so powerful. It's how can you not respond when someone is sharing their personal experience and telling you how they feel? You know, oftentimes as someone who works with the organization, people tell you, well, how do you know the women feel this way? Or how do you know this is such an awful thing? You know, like it's not your story to tell, but you cannot deny it when someone is telling you their personal experience and what it's like for them.
Yeah, yep, I'm really feeling that too. I'm feeling so many emotions and not sitting still, just pacing around, just remembering, 15 years of seeing these things up close and hoping the rest of the world is getting a real proper taste of what's really going on in our prisons. Chantel, we'll go around, Chantel, then maybe Peggy, then Ray. Can you just, each of you say, what is your work? Why you're sitting on this panel as a prison birth worker? And what's your unique role in that work?
Sure. My name is Chantel Norris. I am the co-director of the Alabama Prison Birth Project. I am a doula with the project, and I also am a certified lactation counselor. So I coordinate the lactation program at Tutwiler Prison in Alabama. And what brought me to the work, I had a family member who was incarcerated when she gave birth. I didn't even know that was a thing that we were doing in a civilized society. And I was appalled and outraged and knew something needed to happen and somebody needed to do something about this thing. Little did I know that somebody might be me.
Or what you were signing up for.
Right. But it's so worth it, right? To affect change for even just one person. It's totally a worthwhile endeavor.
Right. Peggy, you want to go next? I think you're unmuted, Peggy. I think you can just talk. They unmute us, I think.
Can you hear me?
Yep.
Oh, for some reason my video isn't coming on. I apologize.
We can see you and hear you.
Oh, I just can't see myself. That's fine. Thank you for having me. My name is Maggie Quinn. My pronouns are she, her, and hers. And I work for Chicago Volunteer Doulas as the program coordinator for the Peer Doula program. My role as program coordinator is to build and organize a program which is rooted in solidarity and rejects saviorism, training peer doulas who are incarcerated at the women's prison in Lincoln, Illinois, to be to provide culturally relevant support to birthing people experiencing incarceration at Logan Correctional as well.
We're investing into the loving and compassionate support that incarcerated women are already providing one another. And we've been privileged to welcome the peer doulas and their wisdom and energy into our own doula community. I feel a responsibility to them just as much as to our clients who are pregnant or birthing or postpartum, and using our platform to mobilize and advocate for abolition and at the very least, reduction of harm from the carceral state. And to amplify and share the voices of our peer doulas. Many of the peer doulas are parenting while incarcerated, and they know what that separation feels like, just as many of the previous panelists have so impactfully shared. All of the peer doulas, they understand better than anyone else outside of the organization what it's like to be in prison and how everything works or doesn't. CVD is an organization comprised primarily of women of color, as well as many former clients like myself. We include our peer doulas in decision making. The peer doulas are matched with CVD doula mentors, just like the doulas in our traditional programs. And they form special relationships together and receive support and communicate regularly. I'm also fortunate to be able to bond with the peer doulas and to stay in touch with both the clients and the doulas and to learn from them and to grow the strongest program possible. Beginning with the training where we met in person to match with mentees and to start working together as a team. We feel so fortunate to have such an engaged and now a tight-knit cohort of peer doulas who really have shown us the value of offering programs to folks with longer sentences, because there seems to be a shorter list of what they're eligible for. And they're engaged, loving, participating in the trainings and surviving prison, all while providing their expert doula support services to incarcerated folks. And we also commit to supporting doulas who would like to continue their birthwork career upon release, including a recently released young mom who is currently a CBD doula in training. So shout out to Tiffany, I think she's on here. We love you.
Awesome, thanks. Miss Baker.
Hello, my name is Raylene Baker, and I'll keep my intro short here. I'm the director of the Minnesota Prison Doula Project. Been kind of following Erica around since the beginning of this endeavor, and I just come to this work as a longtime community doula. And once you go inside and you see some of the things that you see, you just can't turn your back on it. And that's why I keep showing up for this work. And to just be here today and see some of our previous clients, Natalie and Autumn are people that we worked with over the years inside, and just to see them be successful and come back to this work in a different way is just, I just feel so privileged to be, to call them my colleagues now. But just, keep showing up for this work, elevating those voices that we, that are inside, that it isn't always easy for them to express what they need, or they're not often heard, especially when they're inside. And so us at the Ostara Initiative and Minnesota Prison Doula Project just try to do our best to just keep showing up for them in whatever ways we can, and especially in this time of just extreme isolation with the pandemic, and it's just ongoing. As you heard Lori Timlin earlier just talk about feeling frustrated, like we just can't get a hold of it to be able to get back inside, not only just our program, but also for those parents to be able to see their family members and their kids. Everyone is really struggling. So that was a little all over the place, but I'm glad to be here. Thank you for inviting me on the panel.
Yeah, thanks, Ray. All right, we're going to start with a question from the women inside Shakopee, and it's very, very specific. So dive deep. Is that okay? The question is, it's something we haven't talked about much today. And that is, in your experience supporting incarcerated birthing people, what is the extent of aftercare post-incarceration, specifically for people who have given birth, in the areas of mental health care they're asking about, physical health care, and psychologically support to help them transition back into family and a parenting role? Who wants to start that? I know, Chantal, you're working on a big case in Alabama where you're doing a lot of that, but I don't want to put you on the spot.
Well, no, absolutely. I don't mind sharing about that. So after incarceration, right, what we're learning as we're able to connect, and during the pandemic, we've had a little more time to be able to connect more deeply with some of our clients who have been released. And we're seeing a whole lot of gaps, a whole lot of needs, and not nearly enough services. You know, how do you access these services? First of all, as a regular community member in Alabama, you probably don't have access to mental health care if you don't have a good job with good benefits, period, right? And we know that if you're formerly incarcerated, you may have a hard time finding a job, you know, finding stable housing, and those are immediate needs. And so a lot of times they're not even thinking about healthcare, or mental health care, even though it is a need. They have so many immediate needs that are not being met. And what I'm seeing in our community is that there are a lot of grassroots organizations in community that see these needs and are stepping in and filling in as they can. A lot of times their funding is very limited. Not a lot of resources available for that, even though it is a tremendous need, especially considering the rate that we incarcerate people in this society.
Right.
And we don't hold them after they're out. We say, oh, go, you're on your own, figure it out. Good luck with that, you know? Yeah. So, you know, as a society, we are failing these people. We say, oh, you've done your time, reintegrate into society, but we're not facilitating that at all.
Yeah, I'm thinking about in the movie Tutwiler, which if anyone's listening and they want to watch it, it's a piece about birthing inside the Julia Tutwiler Prison for Women in Alabama. Chantal is in it. When you're talking to, I think you're talking to Jennifer Baldwin, if I remember correctly, and you're like, so what's your plan for reentry? And she says, I'm just not going to leave the house. Remember that?
Yes, and so just a funny little snippet, I've actually talked to Jennifer Baldwin recently, and you know, we've been in this pandemic and kind of pretty isolated for the past year. And she told me, she said, I told you when I got out, I wasn't coming outside. And I was like, yes, you did. You know,
woman on your word there, Miss Baldwin.
Right. And, you know, we kind of laughed and joked about that. But, you know, we did talk about, you know, what are your needs? What can I, Chantel, do to help? You know, what can we as an organization do to support you? You know, we're working with a client now who has some legal battles going on. And so we're just wrapping around her in the ways that we know how, you know, helping her schedule appointments that she needs to schedule, helping her figure out her housing situation. But the reason that we're doing that is because where she lives is in rural Alabama and there is no support available to her. You know, so we're asking, you know, you or other colleagues that we work with or have professional relationships, you know, I know someone who's a counselor. Would you be willing to work with this mom? She's having some issues, you know, and just a lot of people volunteering services because there is nothing in place to hold these people.
It's pretty scary, isn't it?
Absolutely.
What folks are released with to go out in the world and be successful. There's very few humans that I know that can leave with what folks leave with prison and figure out how to make a good life with that. It's a very big lift, right? Maggie or Ray, you want to talk about that? The question was just about like, what really is the extent of aftercare post-incarceration for birthing people in terms of mental health, physical health, or psychological supports for family reintegration?
I could add a couple thoughts. I think Chantal illustrated it really well, where we're just kind of scrambling. What can we do to support? Where can we pull things in? We send people back to community expecting a lot and not really helping them. And, you know, these are our neighbors, our community members, you know, their kids are going to school with our kids, and it's our responsibility as a community to help them be successful. I mean, I think, you know, a lot of times when people end up in prison, I feel like the community has failed that person. Like, you know, many people are in prison. They're not posing a security risk to us. It's kind of gotten to that point where we failed them, and, you know, the consequences being separated like that. And And then to just send them out with little support, I mean, the answer is there just really isn't. There really isn't support. I mean, you might get someone that comes out with a good parole officer that connects them up. You know, we might have someone who herself is good at advocating and speaking up for what she needs, and she may know that she can reach out to us or other programs and really, you know, speak up for what she needs. But that is just not the case for everyone, you know, and we just expect them to just know exactly what they need to do and to just do it successfully. Get housing, get a job, you know, be there for your parents, or your kids, be a good parent, you know, do all the things that need to happen, you know, and don't come back to prison, you know. And it just, we see these violations and they come back, and it's just, we need to do something more to interrupt that cycle. I mean, we really need to focus on that. We're talking a lot about that as an organization. I mean, we've had to pivot from in-person services, of course, with the pandemic, and we're doing what we can virtually, but then we're also looking at how can we support justice involved people that are in the community right now that could potentially go back. Maybe they're on supervision, maybe they're not, but how can we support them to stay in the community, to stay with their kids, to be healthy, to be successful, and just really try to focus on that. And I don't think it is going to take a lot. I just think we need to look at the population and listen to their needs and just respond.
Right, because people know what they need. It's just that folks aren't really willing to have these conversations and aren't really willing to listen and aren't that willing to invest in this issue in a way that is required right now. That's what I would say our experience has really been. I'm amazed at Alabama though, and the mutual aid, and for all the bad rap that the prison system gets there, I'm gonna like call out the mutual aid in Alabama, which has been kind of blowing my mind, honestly, to come around folks. And I think we can rely on that a little bit more. It's just putting calls out to community and saying, you know, does anyone have beds? Does anyone have baby things? We are such a capitalist society, have so much material things. And then there's folks that have nothing. Like, can we please be sharing that around in a more equitable way? Maggie, do you wanna add to that?
I was just going to add, and yeah, shout out to mutual aid for sure. Taking care of ourselves is really the only way to go about these things, rather than relying on these inefficient institutions to provide that support. But yeah, I mean, we experienced during the pandemic, one of our clients being released to, you know, electronic detention, and which is, you know, a good thing that she was able to be home. But on the other side of that coin, it was, you know, she was 38 weeks pregnant. She couldn't go anywhere to, you know, get the groceries that she needed for proper nutrition, to have access to her WIC office, to get the coupons that she needed to sustain herself, and you know, find a provider that would accept her insurance and that, you know, she felt comfortable with, or could even take her on at that phase in her pregnancy. Just, you know, there was literally no support system in place for her, even in a city like Chicago, where, you know, we are rich in all senses of organizations and groups, but coming from the state, there was nothing. So, you know, the support that some of our clients say that they have received from organizations like ours and all of y'all's is the only support that they were offered. So I think coming into the question posed about, you know, what it's like postpartum, as well as reentry, there really is nothing, at least not an IDOC.
Okay, sounds like we have a consensus that we need to do some work in this area. And by some, I mean a lot for the rest of our lives, probably. I'm sorry that I am like maybe seeming lighthearted at times about it, but I think for the people I know on this panel, Ray and Chantel, we can attest to, it just gets heavy and dark fast. And we have to laugh sometimes, and we have to just be in community and just keep going, even when it, like, sometimes these barriers just seem insurmountable, right? So that actually is a segue to the next question I wanted to ask. which is what's your practice for remaining hopeful and continuing to get out of bed every day and keep doing the work when we're being witness to lots of human rights atrocities like have been shared on this workshop today? And how do you keep your heart and your brain protected so that we can keep going? Because we know we're tackling problems that are centuries old, and it's going to take the rest of our lives to do this. So how are you preparing yourself to do that? Chantel, how you doing that?
Well, I think one of the things that keeps me hopeful is the women themselves. They don't lose hope. They never say, I quit, I'm throwing in the towel, I'm done with this, whatever. You know, I have never heard a woman say that. You know, she's always showing up, even when it's hard. For me personally, the hardest part of this job is having to go to the hospital on the day that I know a mom is going to be separated from her baby. And I lay in bed and my alarm goes off and I lay there and I think, man, I do not want to do this. You know, like I just physically, I am feeling really heavy and I just don't know how I'm going to get through this. And then I think there's a mom who is experiencing this. And if I don't show up for her, no one will, you know, and she's going to have to do this all by herself. And I am not going to allow that to happen. You know, even if just showing up and letting her know, acknowledging that I see her. This is totally messed up, but I am here in this experience with you. You don't have to do it by yourself. That's the thing that keeps me hopeful. You know, like, I feel like I don't have a choice, right? Like,
yeah.
I you know, knowledge is accountability. I know that this thing is happening. And so I'm holding myself accountable to do what I can do in my little role to, you know, create some change. So yeah, and then as far as holding myself together, like outside of work stuff, the self-care, one of my most favorite things to do is to get a massage. I don't do it often, you know, like that's a treat, you know, but that is my self-care. You know, I afford myself that thing to just be able to zone out when things are just really heavy and I'm having a hard time and I'm struggling. For me, that is my thing. And my practitioner that I use, she's a sister, you know, in my sister friend community. And, you know, just allowing her to love on me in that way, you know, like to replenish me, to fill me up, you know?
Yeah, thanks for sharing. I've been thinking a lot about how trauma gets stored in our body. And so is there a way in real time we can be working it out of our body so it's not building up? And I think like body work of any type is a really good way to work on that and to be proactive about it, right? Before it catches up with you. And then, you know, you've been drinking for 5 nights in a row and you call one of us crying on the phone. Not you drinking, me maybe drinking, or maybe it's Ray. She drinks a lot of beers at hockey games.
Oh, lies, Erica.
I think I have a text to prove. Ray or Maggie, do you guys want to talk about, you know, one really quick I'll add is just like our relationships with each other keep us resilient, right? The way we are we're always in relationship with one another, talking almost every day to each other about how the system is messed up, what our clients are going through, what it feels like in our body, you know, what's scaring us. So that's, I'm not on this panel and I'm sorry to add, but that's my self-care.
I could add just, yeah, the team that we work with, you know, Chantel, Erica are on the team with Ostara and the Alabama and Minnesota programs. And we just all come to this work to do the work. It's like a life's work. It's not a job. Like there's really no separation of like personal stuff and work stuff. And that's okay. I mean, we just come to this work, we show up, and what keeps me going is, like Chantel said, it's the women, it's the people that we work for, that they don't have, you know, choices in what they're facing to deliver in custody, to be separated from their babies. And it's just something I can't turn away from. They keep me going, you know, showing up for them every day, and just having this whole group of women that I work with that just lift you up when you're having a really bad day, or you've seen something that is just so hard to see and you have to process it with somebody, to just have these, these people to just be there and all together. And yeah, and self-care is super important. I mean, our model of work, I feel, is so unique, where we're like, you wake up on Monday and you're just really not feeling good. You go back to bed and come back to the work when you're ready to do it. Like, you got to be in the right frame of mind to show up for this work. Like, it is so deeply important that you need to take care of yourself before you can come and show up to do this work. And we just keep doing it every day. And yeah, it's the people that we serve keep us going, for sure. And then it's our allies too, like the people that you're hearing from that work for the system, or our lawmakers. It's all of those partners that help us keep going too. Like, we wouldn't be allowed inside these facilities if we didn't have these people who trusted us to come in and sit alone with these people that are inside. I mean, they're all super important relationships, and they're relationships that we work on every day. And we have been working for 15 years to build these relationships, and they're really important to us, and we just keep on going. I mean, in Minnesota, we're really lucky to have commissioner's office right now that is super supportive to the things that we want to work on and what we have been working on for over a decade. And and I just feel really grateful that we're all coming together to keep doing this work, and hopefully working ourselves out of a job, as the theme is to end prison birth in America. I mean, there is a better way to do this. There's a better way to just support each other as a community. And I feel like we're getting there. And Erica always says, and I always think about this, is slow change is lasting change. Sometimes I just want it to happen right now. Like, I don't want a single person to go through any of the things that I've seen ever. But like, I know we're slowly getting there, and this slow change is going to be the lasting change.
Thanks. Maggie, would you like to go?
Yeah, our same as me, as y'all, just in terms of, relying on that community. And, our peer doulas are incarcerated, so we have to actively, nurture and pursue that community. It really was imperative that we continue to engage with them, especially during the pandemic, when they couldn't see their clients or their family or anyone during this time. And it's a struggle to work within this system, the system that we know is broken, and experiencing the structural barriers to achieving some of the results that we're aiming for, in addition to I lose sleep thinking of the birthing people and the peer doulas, and how their humanity is not being emphasized. And it can rip a hole in a person. And what I do personally to combat that is, to remain in close contact with them, as well as to spend time with my own children and come from a place of gratitude that I'm able to do that. My children are still 3 young ones, so I wish I could say I did more in terms of self-care, but right now that's kind of where I'm at, just staying in touch with them. I actually have a letter from one of our peer doulas that I would love to share with you about that, if that's all right. I'll try not to be emotional, because it's not my emotion to share. And I just really want to say that even though they can't be a part of this panel, they're definitely part of this work. And I want to celebrate and acknowledge that, because it is here. This is from Tammy. She is a peer doula at Logan. She's a Black woman and a mother, and she's extremely dedicated to her clients. She's been CBD doula, the champion of the quarter. And, like through the pandemic, like I said, we've all been emailing a lot as the only form of communication readily available at this time. And Tammy sent this to her mentor and gave me permission to share it with y'all. Being a doula has allowed me to know that we are not forgotten, and no matter where you are, you can make a difference. It is a blessing to be a client resource, to give them the information, to allow them to be better, to better themselves, as well as to be more productive caregiver for their child. It feels great to know that I made a difference in another human life. Prison can get you down, depressed, and outright suicidal thoughts when one feels cast out and no one cares. So I am blessed to be a doula and be treated like I matter, for I am breathing, which means I can help everyone who allows me to be of service, for I am alive and an able body and with a functioning mind. So thank you, doula sisters, for allowing me to feel worthy by being a resource, as well as knowing I still matter, even here in prison. It is such a joy to have the mentors to check up on us now during the virus and even when there was no virus. It is sad but true that before the doula program, I had no email account, for my family stated it was too complex to set up. So it is an honor to be a part of an organization that actually cares not just about how I can help them, but to really care about me and how I physically as well as mentally am doing. The doula program is a blessing from Allah, and I am so grateful that I was chosen to be a doula, as well as have a ready career waiting for me upon release. The doula staff are warm, loving, non-judgmental, kind-hearted, embraceable huggers who are exceptional individuals, and I'm proud to be affiliated with this organization. So I want to thank Allah for allowing me to understand that we are all family and related by the spirit that we choose to accept and awaken that is inside of all of us. So yes, doula, I consider y'all my extended family, and I thank you for making me feel so welcome and deserving of allowing me to be helpful to a client who might need knowledge of anything to better their situation physically or mentally, to have a better outcome for them and their child due to them understanding, and for me to have provided the information. It is a pleasure for you to allow my thoughts to be shared. Thank you, because now I know that I still do matter in this life. Tammy.
Thank you for sharing, Maggie. I think this might be a good, just very quickly, if you could share like the difference between a peer doula model, how you define that, versus some other doula projects, or just what your regular community doulas do, because I know there are some projects that are starting now with more of that model. So it's an opportunity to kind of share what that looks like.
Sure. So our model is to work with the prison right now at Logan Correctional to train 9 peer doulas we had initially, where we went with trained facilitators to the facility for 3 days, and brought along the doulas that would be mentors, and offered them the opportunity to connect with all of us and to choose who their mentor would be, and then to work with the women's programming coordinator there to provide, to offer doula services to the pregnant people at the facility upon intake. And the difference is that the doulas, the peer doulas, are actually incarcerated at the facility as well during the time that they're providing the service, rather than being like an outside community doula group that would come and provide support to the pregnant people during probably just maybe birth. I don't know if they have a traditional visit relationship like a traditional doula would, but in our case, they're there with them the entire time and able to meet with them on their own schedule. And, or well, not right now during the pandemic, but ideally. And that is our plan, to return to that model. And yeah, we, the doulas are in touch with their mentors virtually, and they provide that continued support for the peer doulas. And that community that we were all just saying that we all rely on, that peer doulas do as well. And then we support them on their journey to birth working. And if they want to, become a certified doula upon their release, then we work with them to do that as well.
Okay. Is a peer doula, is Logan allowing the peer doulas to go to the birth or to go to the separation at this point? Or obviously not in COVID, but is that the plan that will be able to happen when the restrictions are lifted?
That is a goal of the program long term. Unfortunately, shortly after the launch of our program, the medical lockdown occurred with the pandemic. So that's not something that we have been able to do thus far, but it is something with the support of the warden down the line that we would like to do. But for now, our relationship with the prison is to support the peer doulas who can provide prenatal and postpartum support, both in terms of informational support, which is really crucial for incarcerated folks to know their reproductive health care rights, and then again when they return to the facility without their baby, and they need to be supported postpartum.
Okay, cool. Thanks for sharing that. I know there's a couple other projects that are starting now around that model. So Maggie's project at Chicago Community Doula Program, that's what it's called, right?
Chicago Volunteer Doulas. And actually, as far as I know, we're the only program that is doing it this way. And so if there are others, we would definitely love to be connected. So please reach out.
Yeah, I think Topeka Sam's group is working on something like this right now. Could be wrong, but I think so. Okay, there's a question from the chat that I think is important to answer. And that is, how do we go about providing as much care and support as well as dignity for birthing people, while also making sure that we're not reinvesting either financially or otherwise into a system of punishment, so that we're moving toward a system. Okay, this person is saying to the result of people believing in reforms rather than abolition. So Maggie, you identified yourself as abolitionist, so I'm guessing you might want to speak to this. But also, I think there really is this conversation in our country around reforms in criminal justice or abolition, and a lot of different thoughts and feelings about it. But the real question that this participant is asking is about the financial and maybe practical resources. So how do we as programs be responsible to not just, we have a lot of conversations about this internally, like how are we not just supporting this system so it can continue to do harm, essentially? Do you feel like that's, Chantel and Ray, did I summarize that okay? Because real change is ending prison birth. So anyone wanna talk about this?
Sorry, could you clarify?
I can go.
Okay, what are you asking?
So the question is, how do we help people get the care and dignity they deserve without investing in carceral systems, I think. Okay. Chantal?
I think one way of doing that, because like you said, we've had these internal conversations as doing people who are doing the work inside the facilities. We don't want them to feel like this is enough. Oh, we allowed a doula program to come in, and so that's all we got to do, and we can do this for the next 1,000 years. That is not the goal. But I think not investing, with our donations, with not giving money to our state DOC, right? Like, let's make sure that we're investing in people who are actually doing the work to create change. And also supporting legislation that creates change. There's a Omnibus Act that was presented by Representative Lauren Underwood that has specific language about incarcerated people in there, making sure that our people in our state representatives, our senators know where we stand on this. Like, hey, we see you. We know that this is happening. This is my interest, you know, as a public community member, and I want you to support it. We need change, and pushing for change in those ways. But number one is just being aware of what's happening. B, you know, just whatever opportunity you have to support, being aware of what it is exactly supporting, right? So not giving money to DLC so they can hire more officers, perhaps supporting a program like the Chicago program or Ostara Initiative, you know, things like that. People who are doing the work and creating the change that we want to see.
Yeah.
I think that's one way of doing it.
Yeah, and also recognizing that we're all working within unique environments. So in terms of geography, so what might be radical or really moving the needle in Minnesota might look different in Alabama, though my experience has been that's not exactly true. As you saw, Alabama has the best lactation program in the country right now, Alabama. So I don't think we should let that, which Chantel built. You're amazing, Chantel, which we should not let that create barriers for us in what we think is actually possible. But like in my mind, we should also make assumptions about, because you're in Chicago, it's a more progressive place. Like they have some policies that seem more progressive than, or like what's happening in California feels more progressive, so much more progressive sometimes to what's happening in the Midwest. But in this one issue, I've seen a lot of progress being made in a lot of different places. Ray, do you want to talk a tiny little bit about like some of the stuff we're working on in terms of the Healthy Start Act, which is just stopping people from being incarcerated who are pregnant and postpartum as one potential solution, and how our DOC is trying to reroute that money out of a prison system and into community-based supports?
Yeah, first I want to point out one comment. I think that was Ashley in the chat, where she just says, right now we're doing harm reduction until there's no more prison birth. And I think one way of doing that harm reduction is with the Healthy Start Act in Minnesota, where it's going to give the commissioner's office authority to look individually at the person who's pregnant or postpartum and to say, like, what are the things that you need? What, even just like, what led you to this moment, and how can we support you to be successful and not be separated from your baby? I mean, I just think like we need to be doing so much more than that, but I feel like that's going to be one little step by looking individually. And we're not talking about hundreds of people that, you know, are going to have their babies inside and that are going to be inside in the immediate postpartum. It's really not that many people here in Minnesota. I mean, we look nationwide, but when we're looking at what the Healthy Start Act will do, it's just going to look at individuals, how can we support them? And like Erica said, diverting some of those funds where maybe, you know, then there's going to be a contract with Minnesota Prison Doula Project, or, you know, a treatment facility that then instead of us as, you know, people, taxpayers, putting that funding into the facility to give them this subpar diet and medical care that we keep hearing stories of, we could support that person in the community, make sure that they get the support that they need, whether it's treatment, whether it's you know, job skills, you know, and then matching them up with support like the doula project or other things, and following them long term. So really looking at how can we support this person for at least that first year of the baby's life, and everything that you need. And some of the things that we do as doulas, you know, doulas are supporting people who are giving birth, people who are postpartum, but we're also, as prison doulas, are doing a lot more than that. We are we're supporting people one-on-one just with parenting support. So we're just like, hey, how are you struggling as a mom today? Like, how can you connect with your child over the phone? Like, what are some ideas of sending something home to your kid? I mean, those are just like the little things that we're doing as prison doulas that differ from what you might think as the role of a doula in the community. And all of those things are really important. And the Healthy Start Act is going to allow us to be able to do more of that outside of the correctional, you know, setting, and be able to support people in the community. And, you know, really importantly, keeping them together with their child so that we can, you know, help that trauma from not even happening to that child. And like, You know, we know that that beginning of the life is so important and crucial for bonding and connection for that child to be with their parent. And also we know that the parent is primed for change during that time too. So if we can capitalize on that, we can say, we know like hormonally and everything, you are primed right now to change and to bond with your baby. And how can we use that to help you be successful in the long term, and, you know, and to be able to take care of yourself in a healthy way and your family. So, you know, I think there's a lot of work to do, but I really feel like this pandemic has gotten a lot of us to just slow down and look at what's going on. How can we do it better? Let's listen to people more. And I hope that's one thing that we really just keep after the pandemic, is just we're listening to each other more than we ever have before. And that's what we need more of.
Yeah, that's great. I think it's going to be a little pilot here in Minnesota to say, all right, as a state, we're willing to spend $40,000 a year to incarcerate a person. We know that number is probably much higher for someone that has complex health issues and is giving birth during incarceration. Could we take, let's just say that number's $45,000. That moves with you. Could it move out of incarceration? Could it wrap around you in community? Could it purchase and create access for you to all kinds of things that you're needing? And I don't know what those things are. You get to tell us what those things are because you're an expert in your own life. There are a lot of resources in community. Can we find a way to kind of knit them together, create little bits of new things, reduce some of the barriers to access to those things, and have better health outcomes for babies and mothers and long-term well-being for more people? Maggie, do you want to talk about this? I'm sorry, we've been chatting now for a minute about it, but how do we give people the dignity and care they deserve without reinvesting in punitive systems?
Mm-hmm. Well, again, as Ray was describing, it's about harm reduction, and our program still is a harm reduction program, but we can still partner with other organizations to continue to work towards abolition. Our executive director, Anya, just dropped in the chat actually, the Women's Justice Institute is a partner of ours who just released their Redefining the Narrative report, and Mothers United Against Violence and Incarceration, which is an abolitionist organization supporting survivors and advocating to fight back against systematic exclusion and systemic violence. So yeah, I mean, I feel, and I don't know if the other doula groups relate to this, but our access to providing this support sometimes feels like it's in a precarious state. And it is difficult to work towards achieving, you know, the long-term goals while still being able to provide that support. So that the question that you're posing is something that is really an internal struggle, yeah. But one that's definitely worth discussing. So thank you.
Yeah, I think very important, and we're going into some like visioning and strategic planning this summer. And I think we as organizations have a responsibility to community to really be asking ourselves, like, what are our, not just our organization's values, but specifically our financial values out this in particular. So it's a good question. Thank you, whoever asked that. In the last, looks like there's 6 minutes left. I'm hoping that I think some of this content can feel very heavy today, and it needs to be feeling heavy, but can we talk a little bit about, with your own eyes, what is one actual tangible change that you have seen, Chantel or Ray or Maggie, in your time to kind of instill a little bit of hope that we're on the right path, or that change is possible in this really complex system of intersecting disparity and oppression that sometimes just feels insurmountable?
Sure. So I think for me, one of the change that I love this change. Prior to our program, you know, incarcerated women, and Autumn talked about it in her talk, you know, incarcerated women were abused in all kinds of ways at Tutwiler, you know, #1 worst prison ever in the country. And to see them move from there to us being able to have a lactation program and seeing newly postpartum moms or even pregnant moms getting excited about breastfeeding their children. And some women have never seen anybody breastfeed. You know, I was a lactation person before I came to this work. And so I get excited about breastfeeding. And so just sharing that knowledge and that information with women and empowering them to make those kind of decisions for themselves and seeing them want to parent their children in the best way possible. And so allowing them to be able to do that, even though they're separated, they're allowed to, or they're able to provide nutrition for their children in a way that only they can. And they get so excited about it. And I mean, like, this is one of their favorite, I mean, they love our program, of course, but they are really appreciative to be able to send milk home to their babies and do something and support their babies in a way that only they can do. So for me, that's the thing I get most excited about.
Yeah, it's been a long time in Minnesota trying to get a lactation program. As you heard Autumn talk about, there's been specific moms that we've advocated for. It just hasn't been possible yet. But to go into Tutwiler with Chantel and to pick up milk and then to go ship it to infants, it's a good day at work.
Yep.
Thanks, Chantel. Thank you for all that work too. It's amazing. Ray, you want to go?
Yeah, I'll go. I hope that we'll get there sooner than later with lactation in Minnesota, because we have an excellent model with the Tutwiler program, and we can make it happen like tomorrow. So I hope that DOC will come on board with that. But two things that I think of when I think about lasting change, of course, is the unanimous passing of the anti-shackling legislation in Minnesota in 2014. I mean, that was just something like, you know, we did all this research and prepared ourselves for it to really not pass, you know, like these things don't pass the first time. And then to see Minnesota just really show up and pass that unanimously was incredible and a lasting change. And then the other thing is just the culture shift that we've seen at the prison, you know, like just those first births that I went to the ones more recently, it's just, there is so much more respect coming to the room. It's, you know, when we look at the officers that are in the room, I mean, those first births that we went to, they just kind of were doing their thing. And then there was no witness there. There was no doula to see what was going on in that room and the disrespect that was happening. And to just see it shift to now, like we show up and we're like, we're dimming the lights, we're seeing what the mom needs, and we're doing all the things that doulas do, but we're also just modeling like, this is an important day. A new human is about to be coming into the world in this space with you. And there's no choice in that matter. Like we're all going to be here. And so just seeing like that space be respected, that has been a tangible, lasting change that I'll hang on to for sure until we don't see that, you know, don't see the need for having prison birth anymore. But yeah, so those are two things that definitely keep me going. We can keep making change if we can make those two big changes.
How about you, Maggie?
We also saw an increase in interest in lactation support, especially during the pandemic, when, you know, they couldn't see their baby once separated, but keeping that connection and planning ahead for being, you know, reunited and hopefully continuing that bond and providing the best possible nutrition for their babies became increasingly important. And I would definitely love to learn more about the model that has been developed in regards to transferring that milk safely to the baby, because in some cases it was just an issue of keeping up supply in hopes that later on they could give that to their baby. Lasting change in terms of our program is, you know, we've definitely seen an increase in interest in becoming a doula and serving our communities and serving their own communities rather once released is going to be really important. to creating lasting change as well as from within the system while they're there. The informational support that the peer doulas are providing to inform incarcerated birthing people of their reproductive healthcare rights. We've seen, coercive consent happening especially with inductions, which we know can be a very violent way to bring a baby into the world, especially when it's not medically necessary. So those are some things that we've already seen changing. And our organization, we have measurable outcomes and statistics that really defy the state and national averages. We would like to see that continue throughout our programs, including the peer doula program.
All right, thanks. There's so many comments coming in the chat, and I'm gonna openly admit I'm not the very best at this. I think we're reaching the end of our time. Susie, could you just come on and check in with me if the Lieutenant Governor is here?
She is not. I did send you a message in the chat, but there's a lot happening there. So we could take another question or two. If anybody wants to put one in the chat right now, that would be fine.
Okay, I'm reading through the chat right now. Okay, so people are asking about like replicating projects that we're working on in other parts of the country, and are there resources for how to get that started? So that's a great question. We get that question a lot. And I also just wanna say really quickly, we didn't name all the components of our program. So I'm gonna quickly list them, and then we'll talk about replication for 5 or so minutes. Does that sound good to you guys? All right, so all the components in Ostara that we offer are the lactation program. We offer the doula program, which begins as soon as the woman is identified as pregnant, the women or birthing person identified as pregnant, and then up to 1 year postpartum. There's even some circumstances where we continue to work with the person after that point. Inside, people are asking a little bit about materials for groups. So inside Tutwiler, there is a group called Pregnancy and Beyond, which is a birth, prenatal education, early postpartum group, education and support for specifically tailored to the unique experience of incarcerated birthing people. What's unique about Alabama is that they also have a nutrition program where they serve a meal inside the prison within their group. It's a really unique and really beautiful piece, as we know that access to like high nutrient food is really hard to come by in carceral settings. Then did I forget anything in Alabama? That's mostly a lactation program, nutrition program, doula program, and then the group. In Minnesota, we have 4 core programs, which are the doula program, just like the one I described in Alabama. Then we have 3 different parenting inside curriculums we offer. We're now supporting fathers that are incarcerated at the request of some fathers inside one of the facilities where we're working. So we're supporting anyone inside that's a parent can pretty much have access to one of our parenting groups if they're in a facility where we're working. Then we also offer supervised visitation. So you heard me talk about in Autumn's introduction that if you're in a county jail, at least in Minnesota, there are not contact visits. So you can't be in the same room with someone, you can't touch them, you cannot touch your children. So one of the jails we partner with asked us to, collaborate and try to build a contact visit program for mothers with children. And then we extended that to the fathers now too. So our group helps coordinate the visit, provides supervision and kind of oversight, because the jail was saying that it's just a lot of liability and our officers don't feel comfortable or trained to do that kind of work. So we offer those visits. And then the final intervention support service we offer is peer counseling. It's just one-to-one peer support around parenting. And it's not, it's definitely an emotional support, but it's not strict mental health support, and that it's not offered by therapists. It's offered by, some people might be therapists, some people might be doulas, some people might be parent educators. And the whole purpose is just to sort of problem solve, get support around really some of these complex parenting situations for people that are living in custody right now. So those are all the projects that we're offering. And if people have any questions about that, we're really trying to raise money right now to open resource share some of our ideas. We're waiting on a couple of big grants, and we're partnering with a few other states right now to move into a replication model where it's going to look like you're an expert about your own community, a lot like how we worked in Alabama. We can all get into relationship with the correctional facility there, but birth workers from community, it could be birth workers inside the facility in some places. We kind of provide training and technical support to help get the program going, and can offer some of the resources we use. And because there's a lot of, like, Chantel, do you want to talk a little bit about when you were first starting in Alabama? We were like, yeah, we'll just come to Alabama. We can kind of teach you what we do. You can take it, use it how you want. But it's what started happening is that there's so much troubleshooting going on, right? That we started just being in relationship and talking to each other. I know Ashley's on here who works in your project too, that at one point we were like, why are we having two nonprofits? Like, let's just save the overhead and work together. That's how that happened. But that doesn't have to happen everywhere else. You want to talk a little bit about that?
Well, actually, it happened pretty organically, right? Like, we were running into things that we weren't sure how to handle or what might be the best strategy, those kind of things. And so we would call up Minnesota and say, hey, how do you guys handle this? What is the procedure for this? Do you have something in place concerning whatever the issue is? And so it was, we were building relationships with each other. And supporting each other. I experienced this hard thing, can we just talk about that for a minute? And also, as we got more in depth and more involved with our program, okay, we need to teach childbirth classes. Well, what are we going to teach? What kind of curriculum do you guys use? Oh, okay. Can we have a call about what's the best strategies in teaching this material? If we're having a hard emotional topic, how do you navigate that? Just all kind of things that you don't realize until you actually get into trying to implement the programs that you may just need a little more help with, or just having a conversation. And it was always helpful just to know you had someone that you could reach out to and ask about it. And you didn't have to we didn't have to reinvent the wheel, and just do everything cold turkey. We had some support in that. And so that was invaluable.
Yeah, I think in the end, that's what we kind of came to, that doing this work together was better for everyone than trying to do it on our own. But that model might not work, and that's great. I mean, everyone is an expert in their own community, in their own work process, and we totally respect that. But we do want to open resource share as much as we possibly can, because there's so much more of this work to do. And I see that the Lieutenant Governor came on now. So I'm going to thank Ray and Maggie and Chantel for all of your great contributions to this panel. Lovely to be with you for an hour. Talk to you soon.
Thank you.
Thank you. Thank you. All right, I'm going to introduce the Lieutenant Governor now. All right, so today we've been talking about so many of the hard truths about the history of our country, and more specifically about our community. Those truths they're rising up from our past now, particularly in the chaos and violence that it's just breaking at the surface in a way we can't turn away from now. And in America, we really have a history of taking what is not ours. And unfortunately, this includes children from mothers and mothers from community. It's really critically important, as we're ending this day, that we talk about the fact that in the last 7 years, of the 278 births that our project has supported, 34% of those mothers have been Indigenous. And 1% of people in the state of Minnesota identify as Indigenous. It is a disparity in incarceration that is not being talked about, and one of the gravest. And we need to keep giving that voice. Absolutely unacceptable. Okay, so there is a through line between the colonization and genocide of Indigenous people in our country and the state violence that we're seeing now, and also prison birth, as you've heard today. Mariam Kaba talks about doing what we can where we're at to the very best of our abilities. We can and we need to be in communication with our local and state elected officials. We need to partner with them. We need to educate them about the issues and experiences that we're having firsthand. Our final speaker is the Lieutenant Governor of Minnesota, Peggy Flanagan. I first met the Lieutenant Governor years ago when she was the Executive Director of the Children's Defense Fund in Minnesota. And she was the first woman that was my age and that was a mother that I'd ever seen in that role as an Executive Director. She went on to be a great ally to our work in the passage of Minnesota's anti-shackling legislation. And her historic career as the second Indigenous woman to be elected to a statewide executive office in US history expands for so many what modern leadership can look like. We thank you for your time and for your service, Lieutenant Governor, and we look forward to your continued allyship and presence in the shared struggle for equity and for justice and for peace and for well-being for all the people in our communities. Thank you for joining us.
Thank you so much, Erica, for having me. And I've been seeing on social media much of the conversations that y'all are having today, and it's powerful. And I remember that first meeting, and it was a powerful time for me to be a young mom, but also really stepping into a lot of these conversations and this work. And I am grateful that we have continued to find ways to partner and to work together. So thank you for your continued work. It's wonderful to be with you in this virtual space today. I'm coming to you from my kitchen. And so if you were in my home, this is where we'd be, and this is the table where we would be sitting. And so I know we're virtual, but welcome to this virtual table. As a community advocate and as a organizer and a mom and an Anishinaabe Kwe, I am really honored to share the space with all of you to talk about an issue that is very important to me personally. And I know that you heard from one of my best friends earlier in Representative Becker-Finn. And to your point, Erica, that also means that her leadership is one of the reasons we find ourselves here able to be hopeful with what is possible when our decision makers look a little bit more like us. So every person in Minnesota deserves to have the basic human right to maintain autonomy over our own bodies, to have or not have children, and to parent the children they have in safe environments. And I'm humbled to join today to be able to shine a light on the experiences of those who spend their pregnancy and birthing year behind bars, and to share more about what we can do at the state level to better support women during these times. That's why our administration has worked with many of you to lead the charge on the Healthy Start Act, which would allow women who are pregnant and postpartum to serve their sentences in community alternatives where they can safely and with dignity raise their child and take care of their own needs too. In the fall of 2019, before the pandemic turned our world upside down, I had the honor of visiting directly with many of the women who are incarcerated in Shakopee. I walked through these facilities with Representative Jamie Becker-Finn and sat down with the women to hear directly about their experiences. We also heard directly from a few of the doulas serving in that facility who are incredible to help women during their birth. It was clear that in that conversation, there was work to be done. And the Healthy Start Act was born out of the tireless advocacy of impacted people and advocates. It's a simple solution to a profound problem. It allows the Commissioner of Corrections to place women who are pregnant or immediately postpartum into community alternatives such as halfway houses, supervise them in accordance to current statute, and provide them with treatments and programming in the placement and location and the duration of their pregnancy. And for up to 1 year post-birth, allow their child to be near their mother for the first year of their lives. Currently, women carry out their pregnancy terms in prison, give birth in a hospital, and return to prison 2 to 3 days after giving birth. Often, their children are being cared for by a family member, but it's difficult to provide the right level of visitation at the hospital, and there are barriers to visitation once mothers have returned to prison, such as caregivers being able to take time off to bring the newborn to visit their mother. Myriad data exists on the negative impacts of incarceration that has on children, new mothers, and their families. The Department of Corrections is also limited in the types of programming available in state correctional facilities that are tailored to meet the needs of mothers. Research shows that higher levels of postpartum depression for women who are incarcerated when they give birth. The separation is stressful to both the child and the mother. In the majority of cases, women who are giving birth while incarcerated in Minnesota, the mothers are reaching their release dates within 6 months of giving birth. When I looked at the Department of Corrections, the data that had been pulled together, I was stunned, but also not totally surprised, because those of us who've done this work know it and have seen it firsthand. As Erica mentioned, a total of 278 pregnant women were sentenced to serve time in prison between 2013 and 2020. 34% of the pregnant women were Native, 12% were Black, and 53% were white. 77% were in prison for technical violations of supervision. 84% had nonviolent governing offenses. 77% were sentenced to prison while pregnant for less than 9 months. The median length of stay for pregnant women in a Minnesota prison is 4.5 months. 41% of mothers who gave birth while incarcerated reached their release date within 90 days of giving birth. 54% released within 6 months of giving birth, 67% within 9 months, and 76% within 1 year. One study looking at visitation between children and mothers in prison found that on average, caregivers lived 117 minutes or almost 2 hours from Shakopee. 56% of caregivers who reported never taking the baby for visits to the person. As the folks at the Children's Defense Fund Minnesota said this session, we must consider who is paying the price. Our current short-sighted way of handling these pregnancies punishes babies with potentially devastating long-term consequences. Mothers and children both experience the trauma of separation, unable to create the strong bonds that sustain and nurture child development into the future. The Healthy Start Act is an opportunity to revise ineffective public policies to positively impact 2 generations at one time. And this act is being led at the Minnesota legislature by women on both sides of the aisle because it matters. At the same time, we are also taking action at the administrative level. With a push from advocates, the Minnesota DOC has been working towards a more respectful approach to the incarceration of women. The DOC has made the following administrative policy changes. Ended the practice of housed out of facility for incarcerated women. This population management strategy involved placing women in jails where there wasn't enough programming or recreational space available to address capacity issues. 2 years ago, advocates requested this practice end so that all women have access to the treatment, recreational space, and programming available in prison. Ended the unspoken no-touch policy in Shakopee. For 8 years prior to taking office, Shakopee had an informal but instituted no-touch policy, which even prohibited touch such as high fives. We recognized the impact of this policy and reversed it in the end of June of 2019. Ended the practice of requiring birth certificates before newborns could visit their mothers. Until October of 2019, we were still requiring official birth certificates for newborns, which delayed visits by 6 to 8 weeks and caused a gap in a mother being able to see her baby. Ended the practice of strip searches of pregnant and immediately postpartum women. Instituted a new lactation policy and required the provision of feminine hygiene products for free. We did not simply change the policy. The DOC also led a bill last year to require the department to provide these products for free. And it's not just policy, but it's now also the law. And there is certainly more to be done. And I am grateful for everyone who has a hand in the Healthy Start Act and has made your voices heard. It has made a tremendous difference. And I'm really hopeful. I am not always hopeful about what can happen at the legislature, but I am hopeful for the passage of the Healthy Start Act. But don't let down your advocacy now. Keep moving. And there certainly is more to do. And Erica, to your point and what has been spoken, the number 34% of Native women jumped off the page for me. And the roots of incarceration is certainly in colonization. And in many ways, the erasure of Indigenous women and women of color. And so I am, as a Anishinaabe, so grateful for the work that you do every day. I am grateful as the relative of someone who is incarcerated and just as a mom and human being for your work. Your work matters. It is the work, and I will continue to work with you in whatever capacity I'm in, if it's at Children's Defense Fund or at the legislature or as Lieutenant Governor or just as Siobhan's mom. I will continue to be with you. So Chi-miigwech for everything that you have done, and Chi-miigwech for everything that you will do in the future to ensure that our mothers, our women, our just relatives have the care and support and justice that they need. Thank you so much.
Thank you so much. We're appreciative of your time and your words and your work. And that brings us to the close of our event. 4.5 hours seems like it could last a very long time, but it feels like we could just blink our eyes and we have learned so much today. I want to thank all the folks who helped contribute to putting together this event, but I would especially like to thank our panelists and especially Autumn Mason, whose keynote was really a highlight of our event today. But also recognizing Mariah, Pamela, Natalie, Julie, and Tommy in the first panel, and Lori, Jamie, Brittany, Huda, Chantel, Maggie, and Ray in the subsequent 2 panels. We're so proud at the CJL to have collaborated with the Minnesota Prison Doula Project and the Alabama Prison Birth Project and the Ostara Initiative this spring. As you can see, the hours of collaboration and care have resulted in a pretty magical set of moments today. We hope that by spotlighting these issues, concerns, and experiences, you will all return to your organizations and work and share what you have learned and move to take action as we have been called here today. As a reminder, this event was archived to our Facebook page, so you can return to it and share it and connect with it in the future. And we're looking forward, hopefully, to next year to returning to offering our events in person, but I wish you could have been with us all here today. The team gathered with Autumn in our Center for Justice and Law space, and we have been cheering and really appreciating the opportunity to be in community, and we hope that you all have felt that energy, even though we haven't been able to go live with that, but there's been lots of cheering and shout outs to you all. So many thanks, and thank you again for joining us here today. We're really grateful.